Good afternoon, ladies and gentlemen. If I could ask you to just please take your seats. Good afternoon again, and welcome to the Dighton Griffith School. To those of you joining online through our various meeting platforms, we appreciate your attendance as well this afternoon as we conduct this third in the series of town hall meetings on vaccinations and testing. I'm Brian Rees, the chairman of the National Advisory Committee on Occupational Safety and Health, and I will be your moderator this afternoon. This afternoon's town hall meeting, which has been extended by 1 hour to 8 p.m., again provides all Barbadians with an opportunity to engage with senior members of the government from various ministries, the labor movement, and the private sector, who I will be introducing to you very shortly. Before we begin, I would ask you to please stand for the playing of the national anthem of Barbados. Please be seated. Ladies and gentlemen, as we always do at these events, we wish to start the event with a safety moment. In case of any emergency or any reason whereby we may need to evacuate from this particular hall, I would ask that you leave through the exit to my right, the main exit, onto the playing field, directly opposite that exit, where you'll be asked to assemble and await any further instructions from the Barbados Police Force, the Royal Barbados Police Force, who will direct you whether to return to the venue or if you should evacuate farther afield. As many of you are aware, the Social Partnership of Barbados met and agreed to establish these opportunities in a town hall format for a discussion on the matter of vaccinations and testing. This is an opportunity not only for us as citizens of Barbados to ask those burning questions which will guide our personal decisions on the vaccine, but also, and I think most importantly, it is an opportunity for us to share suggestions and ideas as far as this matter is concerned. This is a multifaceted and multidisciplined matter, which the entire world is grasping with. Therefore, this evening, we've brought together various subject matter experts to share from their knowledge and personal experiences. Tonight, we are again led in this discussion by the Prime Minister of Barbados, the Honourable Santia Bradshaw, MP. We will also be facilitated by senior members of the government, the labor movement, and the private sector, who are seated on the stage and also in the audience. These persons include the Honorable Wilfred Abrams, MP, QC, Attorney General, Dr. Kenneth George, Chief Medical Officer, Dr. Dale Babb, Acting Senior Medical Officer of Health, Mrs. Sonji Beckles, Laboratory Director of the Bess dos Santos Laboratory. We expect Dr. Linda Williams from the Barbados Association of Medical Practitioners to attend with us. We also have on our stage today Professor Clive Landis, Pro-Vice Chancellor and Principal of the University of the West Indies Cave-Hill campus, who as well sits as the chair of the UWI COVID-19 Task Force and is an immunologist, who has authored numerous scientific publications and policy papers on COVID-19. We have with us also on the stage Mr. Shane Jones, senior journalist and news anchor, who has in the past year voluntarily analyzed the numbers of cases of COVID-19 regionally, and he's kept many Barbadians aware of those changes under his Twitter handle, Newsman. We expect as well to join us on the stage Mr. Akhenaten Burrows, who has spent 17 years in the tourism industry, to give his perspective as well. But ladies and gentlemen in the audience, I would wish you to know that we also have with us the Honorable Colin Jordan, MP, Minister of Labour and Social Partnership Relations, and members of the Labour Department, Lieutenant Colonel, the Honorable Jeffrey Bostick, MP, Minister of Health and Wellness, and the technical staff of that ministry. We will also be joined by Dr. Elizabeth Ferdinand, coordinator of the National COVID-19 Vaccine Program and a former acting chief medical officer. Mr. Anthony Branker is with us in the audience as well, the president of the Barbados Chamber of Commerce and Industry. Senator Rudy Grant, the CEO of the Barbados Hotel and Tourism Association. And I would also like to recognize, finally, both Mr. Edwin O'Neill, President of the Congress of Trade Unions and Staff Associations of Barbados, as well as Mr. Dennis DePisa, also of CITUSAB. I know that is I know, ladies and gentlemen, that is a fairly long list of panelists, but we see this, as I mentioned before, an issue that has many dimensions, and you yourselves have questions that need responses that the government of Barbados is interested in giving. We will commence this evening with a welcome and introductory remarks by the Honorable Santia Bradshaw, Prime Minister of Barbados.
Thank you so much, Chair. A pleasant good evening to everyone. I want to begin, first of all, by really thanking the general public for the participation in these discussions. Persons have come forward both online as well as with their physical presence as well. And we've been welcoming a number of the questions that have been put forward by the public, whether local or overseas, to be able to help us inform our general discussions within the social partnership. I want you to know that we are indeed hearing you, and we are certainly listening. And this process must never be underestimated in terms of the value of the contributions of people across this country being able to make into the discourse on vaccinations. We have looked at common questions that many of you may have. We have also listened to the criticisms about the gaps in information. We have listened to the call for more data to be submitted. We've also listened to you as well, saying to us that we need to simplify the information that is being presented to the public in a way that people can better understand and perhaps appreciate. I assure you that the social partnership, certainly members of the committee have met since the first 2 sessions, and we have had the opportunity to talk through a number of these things and to share some of the contending views that exist out there. And I think we've gotten a sense up to this point as to what Barbadians are hinting to us. We are happy, certainly, that I think most Barbadians understand that there is no plan to impose anything against anyone's will on the people of Barbados. And as Minister Abrams indicated on the last occasion, there's no intention to hold anyone down and place the injection in their arms. But what we have a responsibility to do is to educate and certainly to share with you a lot of the different views that are out there, and certainly our position from the social partnership, all of the varying views. And I'm happy that Barbadians are hopefully coming to that understanding that that has never been the intention, but certainly, you know, there are some who may have different agendas who might put forward those positions, and we welcome all positions, but we have a responsibility certainly to put the information out there into the public domain so people have the opportunity to be able to freely choose what they wish to do. That being the case, I cannot say to you that we can have these discussions without dealing with the current trends that are taking place across the world, and certainly in the region, and perhaps even here in Barbados as well. Notwithstanding views that people may have, whether personal or otherwise, globally we are seeing a number of people contracting the virus, and the numbers are increasing. In just a matter of days, I've watched the country of New Zealand, for instance, close its borders simply because the cases are just increasing constantly. Our neighbors in Jamaica, we've seen, you know, high skyrocketing numbers of cases occurring and throughout the region, and we know that the variants are amongst us, and there's no comfort, I think, that any of us can take from that. I think even in Martinique, they actually made a call for persons to leave because they were concerned that they did not want the healthcare system to become so overwhelmed that they were not able to deal with the issues that were confronting them dealing with sick people. But what we all know is that if something is not done, that these things are going to impact us in a major way. It's going to impact our healthcare system, it's going to impact our social services, and it's going to simply impact our way of life as well. One of the things that we've noticed and that has been coming out of all of the discussions is that we are noticing that the rate of fatalities, the number of people who have been dying, has also been coming down, even though the case numbers have been increasing. And I'm no doctor, but I mean, when I look at, and I listen certainly to the experts, I'm, you know, I'm concerned, but I'm still noticing that there has to be a difference in this period that we're in with the number of deaths coming down versus when we first started at the beginning of this virus. And the truth is that more and more persons have actually gotten vaccinated in the larger countries. Obviously, we are now getting the level of vaccines that we would have wanted initially, and I'm pleased that we were able to get the number of vaccines we did, the 70,000, to basically get a Pfizer over the course of the last few days. And our intention certainly is to give Barbadians choices, because this is what, again, this discussion is also about, giving people the opportunity to choose which type of vaccine they may want as well. And I can say to you that we have, the vaccination team has certainly been working to roll out the plan in relation to not just the vaccines that are here, but certainly other vaccines that are being donated to Barbados, and certainly the ones that we are purchasing as well. So I know you can stay tuned for more information on that in the course of the next couple of days. I think the scientific minds and the experts will draw the conclusions on what is it that is certainly guiding why we're seeing less fatalities, and I will leave that to them certainly this evening and over the course of the next few weeks to speak to that. But I think we can certainly draw some conclusions from what is happening. We will not, and we have said that we are giving people the freedom of choice. We know that there are those who have issues with who should be vaccinated, and that is all for fair comment in terms of the discussion. But one thing that we have learned as well is that Barbados doesn't operate in isolation. And therefore, apart from the strong views that we may hold in this country, the truth of the matter is that we have also been heavily dependent on tourism. And therefore, in all of our discussions, we need to be mindful about the fact that a lot of our social services are also paid and heavily dependent on our ability to sustain tourism arrivals. I therefore am comfortable that we have a fairly dynamic panel, a panel that reflects a bit of the science, but also it reflects the trade union movement. We have not just on this floor, but also on the lower floor, a number of persons that represent the social partnership as well, representing employee and employer organizations. And so I want to commend again the public for participating and for engaging with us, because I can tell you that it has continued to help shape our discussions. And that is why we've even given this evening the additional time to the audience, because we want to continue to hear from you. If you don't speak to us, then we're not going to know that the messages are coming across, and we're not going to know whether we need to shape and change course on certain things. So this is very important to us. So again, I welcome you all, and I look forward to the course of discussions throughout the evening.
Thank you, Prime Minister. I hope the audience will forgive me if I have neglected in that very long list of presentations to specifically introduce Mr. Wayne Waldron as well, who is with us from the National Union of Public Workers, the Acting General Secretary. But my neglect was not because I in any way was slighting him, but because he actually has a special duty to perform later on in the evening's proceedings. So maybe I was saving the best for last, or a special introduction for him later. We're now going to have the next presentation made by the Ministry of Health and Wellness. This will be presented by Dr. Dale Babb. The presentation is entitled, Let's Talk, Reducing the Risk of COVID-19 in Barbados. Dr. Babb?
Thank you very much, Brian. Good afternoon, everyone. Firstly, I would like to acknowledge and thank everyone who has participated in the previous two meetings, whether online or in person. The presentation being used at today's session has been shortened and adjusted to allow time for all of these other persons to speak. So some of the basic information which was shared in the previous two town hall meetings will not be shared again. The presentation is going to look at our local situation and the implications of the effects of a possible surge in cases, with an emphasis on the role of vaccination. So I'll start with the daily dashboard for Barbados. This dashboard, released today, reflects that as of yesterday, August 15th, there have been a total of 4,560 cases diagnosed in Barbados. There were 12 cases diagnosed on the 15th. 103 persons reported to be in isolation at that time, and there have been 48 deaths since the beginning of the epidemic in Barbados. The dashboard also shows the number of vaccines doses given, and it reflects some of the global stats as well at the bottom of the dashboard for comparison. So although this presentation is to be brief, given the number of persons that would like to speak this evening, it would be remiss of me not to mention, sorry about that. It would be remiss of me not to mention these two important markers that we speak of frequently when referring to COVID-19. These are the 7-day average and the positivity rate. The 7-day average allows us to calculate and plot something graphically that shows us a trend in the cases. In the graph that you can see on the left of the screen, the individual red bars represent the number of cases per day, while the dotted line is looking at the 7-day average, or what epidemiologists call the moving average or the rolling average. From the graph, you'll be able to see the rise of cases that we had in January of this year, the peak that occurred in mid-February, and then you can see the cases declining again in March and April. The graph on the right shows our positivity rate as of August 14th. And I want to explain a little bit about it and put the overall concept of positivity rate in context. In essence, the rate reflects the amount of transmission in relation to the amount of testing being done. Initially, the World Health Organization referred to a threshold of between 3 and 12%, but they cautioned persons in terms of how this would be interpreted. More recently, they spoke to a threshold of 5% as it relates to adequacy of testing. The threshold is used as a guide with respect to what measures should be implemented or relaxed, with a higher threshold rate suggesting that you need to accelerate your measures, and with a lower rate, the reverse, an easing of measures. You may be asking yourself what this means for us. What does it mean for Barbados? If you look at the positivity rate, at the peak of our highest wave thus far, which was in February of this year, the rate reached almost 12%. I don't think I need to recount for anyone what that meant in real terms at that time. We were in full lockdown with strict measures in place. So if you compare the rate to the present, our current positivity rate is less than 1%. And at the current rate, we have seen an easing of measures and restrictions. What I also want to mention is that the 5% rate is a threshold. It is not a goal. We want our positivity rate to be as low as possible. That is the aim. I also want to emphasize that even with our current low rate, the effort that is being put into the maintaining of that, the enforcement of the protocols, the various measures that are being employed, the testing, the contact tracing, and the follow-up is huge. It is significant. It is possible for us to become overwhelmed. There is a thin line between maintaining and being unable to maintain. The previous graph shown reflect cases related to the alpha variant of the virus that causes COVID-19 disease. As many of you may already be aware, the Delta variant, compared with the alpha variant, is more transmissible. It causes more severe disease, and it results in a higher percentage of breakthrough infection. By breakthrough infection, we mean an infection that occurs in a vaccinated individual. We have had some conservative projections given to us that show that with an outbreak of Delta variant, we would have at least 5 times more cases than we saw with the Alpha variant in February. The sheer numbers of people needing care would present a significant strain to an already stretched system. I've listened to the town hall meetings that have preceded this one. I don't know if the point has sunk in that we can become overwhelmed. Our health system, our supporting systems, the Prime Minister mentioned our social systems, our infrastructure, our country. I would like to provide an example of what this may mean. If, for example, we had a sudden surge of cases with a more transmissible variant such as Delta, it may mean that one night, you as an individual may have chest pain and you need to seek services. You proceed to the accident and emergency department with the intention and the understanding that you will be sorted out because you have chest pain. When you get there, you discover that you can't be sorted because the department is overwhelmed. You then proceed to another facility. Maybe you go to Winston Scott to find the same thing. Maybe you then proceed to a private facility and find the same thing. The system may not be able to accommodate you if it is overwhelmed. This is what we mean when we keep saying that our system has the potential to be overwhelmed. We don't want to reach a point where tough medical choices need to be made on an individual or a community level. And we are hoping in these meetings to be able to convey the real possibilities that could occur. COVID-19 disease has the potential to affect everyone in this country, regardless of their race, their age, their gender. Once we fully understand the threat, we can see why we would want everyone to be aware of all preventative measures that we have at our disposal. Everyone is at risk of exposure. and could have negative outcomes if they become infected. Those who are at most risk, and these have been mentioned before, are those who have frequent close interaction with sick persons, persons traveling from places with high levels of cases. There are also specific risk factors which may be associated with poor outcomes if someone is infected. These include obesity or having a high BMI, uncontrolled chronic diabetes or hypertension, male gender, and being elderly. Some studies have shown that COVID-19 may be associated with elevated blood pressure in pregnancy, preterm birth, and other adverse pregnancy outcomes. That's the reason why there's a star next to pregnancy, because the evidence, the body of evidence available with respect to that is not as large as existing for the other risk factors that we have described. How can we stay safe? The mantra of wash your hands, watch your distance, and wear your mask has been repeated over and over and over. I will say it again. Wash your hands, watch your distance, and wear your mask. With the exception of measures related to the restriction of movement, prior to early February, before the arrival of the vaccines, this was all we could do. Since February, we also have another layer of protection against COVID-19. This graph is showing a multi-pronged approach to protecting ourselves and others from contracting the virus that causes COVID. It's likened to stacking slices of Swiss cheese on top of each other as a barrier. Each layer on its own has holes, but as the graphic clearly demonstrates, the more layers you have or use, the more likely you are to be successful at preventing the spread of infection. So let's talk a bit about vaccines and the vaccines available for COVID-19 currently. This slide gives examples of the various types of vaccines that exist and the type of immune response that may result from the specific vaccine given. The purpose of taking a vaccine in the first place, any vaccine, is to allow your body to mount an immune response to the pathogen that is being introduced, to give your immune system a heads up, so to speak. The benefit of this is that an immune response is mounted. There are several different types of vaccines. Each type is designed to teach your immune system how to fight off germs and the serious diseases that they cause. The MMR vaccine, for example, is a live attenuated vaccine. It means that the pathogen or the disease organism used is alive, but it has been weakened in a lab prior to being administered. A strong immune response is mounted with that type of vaccine. Hepatitis A, for example, is an example of an inactivated vaccine type. In this case, the pathogen has been killed. A moderate immune response is mounted, and several doses may be required to gain a certain level of immunity. The Sinopharm vaccine, or COVID-19 BIBP, also falls into this category of vaccine. I'll move straight on to the type of vaccine that the COVID-19 vaccines are. The majority of vaccines used against COVID-19 are what are called next-generation vaccines. They're either mRNA vaccines or viral vector vaccines. Now, when it comes to the immune response mounted, you will note that the slide refers to an ongoing evaluation of the immune response. Yes, the effectiveness and the response mounted is still being looked at. No one denies this, but the evidence that is already available shows that a response is occurring in those who have received a COVID-19 vaccine and that response is beneficial. There's an important point that needs to be made here as well, though. The SARS-CoV-2 virus, although we are almost now 2 years into the pandemic, it is a novel virus. It is still a new virus. What that means is that for the majority of us, our immune systems would not have seen it before. Vaccination is just attempting to allow our immune systems to see it so that we have some way of fighting it. It is still a new virus, despite all of the millions of cases that have occurred. It is a new virus. Some of the benefits that have been documented with respect to the administration of these vaccines include the fact that there's a reduced infection, there's reduced infectivity, there's reduced transmission, there's reduced severity of disease. We also have to remember our own population demographics, our demographics here in Barbados. We have a large percentage of our population who are elderly, and we have a high burden of NCDs in the population. As I mentioned previously, we would not wish for our health system to become overwhelmed, and vaccination is one tool or layer in our preventative measures that can help us to avoid this. Data from our isolation facility at Harrison's Point has shown that the proportion of those admitted to Harrison's Point with COVID-19 who are unvaccinated is higher in comparison to those admitted who have been previously vaccinated. 84% of persons admitted this year have not been vaccinated. The percentage of those fully vaccinated who've had a breakthrough infection is low, only 7%. I'm sure that Dr. Ford, if he's able to join us, can speak further to this later on in the evening with additional detail on the severity of illness that he has observed in these vaccinated versus unvaccinated. Vaccines approved via the World Health Organization's emergency use process include those listed here. Examples are AstraZeneca, Pfizer, Moderna, Sinopharm, and others. There have been several concerns raised about the safety of the vaccines. The question has been asked, are they safe or are they not? As with any medical product, the use of the product must be looked at in terms of benefit versus risk. What is the purpose of taking the medicine or using the product, in this case a vaccine, versus what you are trying to treat or trying to prevent? I'll give an example. COVID-19 disease is associated with an increased risk of developing blood clots. It's been shown that COVID-19 vaccines can also cause blood clots. However, the risk of developing a clot as a result of having received the vaccine is significantly lower than the risk of developing clots subsequent to COVID, should you acquire it. The risk is 10 times lower as a result of the vaccine versus the likelihood of developing clots once one has COVID-19. It is about weighing the benefit versus the possible risk. How do we evaluate possible vaccine side effects in our population? This is a question that was previously asked as well. There's an adverse event surveillance committee, which meets every week. This committee receives reports from the various vaccination sites, the polyclinics, the private sector, and the general public. I want to mention what an adverse event report is considered to be, because the word in itself, adverse, implies a certain negative connotation. An adverse event report has been defined as any undesirable experience associated with the use of a medical product in a patient. It is based on the patient's perspective. So having had the vaccine or having taken a type of medication and you have an event that to you is negative, whether it's a headache or a fever or you don't feel well or whatever, that is considered an adverse report. The majority of the reports that have been received by the committee have been those of mild and self-limited issues, and they reflect the expected immune response to the vaccine. So having said that we want to mount an immune response by giving the vaccine, you expect there to be some kind of response. There may be fever, there may be headache, there may be joint pain, persons may feel unwell. We expect this, and the majority of reports are related to this. Once the committee has received the reports, they're looked at to see if they're attributable to the vaccine, especially those that may be considered moderate or severe events. The investigation of these events is ongoing. As mentioned before, the vaccination program in Barbados began in February of this year with the administration of AstraZeneca vaccines. As of August 15th, just over 100,000 persons have received the first dose, and just over 85,000 persons have received a second dose. I should clarify here that this means, as of today's dashboard, of the 101,099 persons who received the first dose, 85,672 of those have also received a second dose. Vaccines have been sourced from various places and through a variety of mechanisms. Most recently, as the Prime Minister mentioned, just over 70,000 Pfizer doses arrived last week, and I would expect that additional arrivals of other vaccines will be in the pipeline. Allow me to summarize, because we do have a lot of speakers that need to share their thoughts. So in summary, COVID-19 continues to present a significant threat to us in Barbados. All members of the population have a role to play in mitigating against this threat, and to be cognizant that there's a real possibility that we as a health system and as a country can become overwhelmed. Protection comes from various measures which have been previously outlined, such as adequate hand hygiene, the wearing of masks, and distancing to help to reduce spread. Vaccination has an important role to play in reducing the risk of serious negative outcomes, such as severe disease and death. Ladies and gentlemen, I thank you for your attention. I will now hand over to the moderator to facilitate the remainder of the session.
Thank you, Dr. Bob, for that very comprehensive presentation from the public health perspective. We're now going to invite Mr. Shane Jones to give us a perspective more so related to the statistics and facts surrounding the COVID-19 cases here in Barbados.
Thank you, Brian. Prime Minister Bradshaw, Ministers Abrams, Bostic, and Jordan, members of the panel, ladies and gentlemen, good evening. I'm thankful to speak on this vital and serious national importance topic from the perspective of a media professional. In our line of work, when something like this happens, it's wide-reaching and it has an impact at the national, regional, and international levels, there is so much information that we have to deal with on a daily basis and have been dealing with on a daily basis. I see some of my colleagues like Rachel here. You know, for the last year and a half, we've just been saturated and immersed in these COVID-19 stories. So we follow all the relevant authorities, both here and abroad, to see if the narratives match up. When new variants come out and there is new information on the virus, we cross-check with agencies like the CDC to see what their response is and weigh it against what our own health authorities are doing, so we can be as informed as possible to ask the right questions and hopefully get the right answers. However, it's not only what the authorities put out that we follow. It's all of the sectors that are affected. It's the theories, conspiracy or alternative, whatever you want to call them. But as journalists, it is our duty to examine all angles and do our best to fact check. And it's because we sift through all this information, all these theories that come out on Facebook and social media and all these social media platforms, that all of us understand that the fear and the hesitancy that many of us have is real. Now, this is not to say that all the information out there is real. In fact, what we have found is that a lot of these theories are a lot of the times made up or take a little piece of the truth and twist it, and then the conclusions and the findings are totally false. But what I'm saying is that it has a very real impact on some people. Here's the thing. If many of us are honest about it, we would admit that there's some level of fear with taking a vaccine, any vaccine. When I got my first dose, I was a bit skeptical, I won't lie, but I felt like if that was a normal human emotion. So when someone isn't totally comfortable, they tend to cling to anything that tells them don't get the vaccine, regardless of if they think the information is shaky, right? So it's something that we've all experienced at some part in our lives. If we don't want to do something and someone says, don't do this because X, Y, or Z, we hold on to that person that says that because we don't want to do it. So we find any information that kind of meshes with what we want to do and hold on to that. But we also have to be very careful with how we respond to everybody's fears. We cannot make people feel like they're doing something wrong for having a normal emotion. So going out as a journalist and speaking to people has taught me that not everyone who is hesitant about taking the vaccine is an anti-vaxxer, and that's important to note that. And we must not paint everyone with the same brush. Our greatest weapon, or maybe not a weapon, our greatest asset in this fight, in any community's fight against COVID-19, is knowledge. And when I say knowledge, I mean the facts. And I want to be clear right now, I have no vaccine agenda. I respect people's choice. What I'm going to do is share what we know to be the facts from independent media research. So when you make your personal choice, whatever it is, you know what is fact from what is fake. As a media professional, I believe in everyone having a voice and having the right to be heard. However, COVID-19 has presented us with some global ramifications that present a very different situation. It's so dire that in this specific instance, I hold being truthful over being neutral. So here are the facts. The officials have always told us that the vaccine will not definitely stop us from getting COVID-19, but will prevent us from getting very ill and also even from dying. So what we have done is not just take their word for it, but follow the story to see where the facts suggest and where they lead. Barbados unfortunately recorded 48 COVID-19 deaths in total to date. Our first death came in April last year. It was an 81-year-old man who had underlying conditions who had recently traveled to the UK. Now, Barbados started administering vaccines from around mid-February of this year. In the 9 months between our first death and when we started administering the vaccines, we recorded a total of 36 deaths from COVID-19. Now, in the 6 or 7 months since the vaccination campaign started, we have had 12 deaths. Now, that is just a third of the number before the vaccinations began. Now, whatever your view is on the vaccines, those are the factual figures, and they back up the information that the health officials have been saying, that the vaccines will stop people from getting very ill and dying. So before we had the vaccines, we recorded 36 deaths. After we had the vaccines, we recorded 12 deaths. And if we look at those numbers even more closely, 6 of those 12 deaths in that period after the vaccine started came in March, which is just after the vaccine rollout. So chances are that most of those casualties might have been infected before the campaign started in mid-February. So you can cut that number by half again. Remember, I was saying that we try to weigh what's happening here with the international information. So the CDC in America is reporting that the over 163 million fully vaccinated people in the US have protection against all known variants, and their jobs are preventing them from severe illness, hospitalization, and death. So that was another fact that checked out and is being mirrored here. In terms of our own cases, if we go back to December 1st last year, we stood at a total of 278 confirmed COVID-19 cases. By March 1st of this year, 3 months later, we moved to 3,155 cases. That's 2,837 cases in that period, and this is before the vaccine started. Now, if we look at March 1st to June 1st, which were the next 3 months after the vaccine began, we recorded 902 cases. That was almost 2,000 cases down in an equivalent 3-month period. So as far as the data shows, the difference there was the vaccines. At that point on June 1st, we had 60,553 people fully vaccinated. Now we come to our present results, almost another 3-month period. We're just a couple weeks shy of another 3-month period. And yesterday we stood at 4,548 cases, representing a further 531 cases. So while we had over 60,000 fully vaccinated in the first 3 months period, when we look at the numbers in this one, it's 40,483. So we have been able to equate vaccines to lower deaths and lower cases. Those are the facts of the figures. And I'm not choosing sides, really I'm not. It's just where the research has led us. So what does this information say to us? We couldn't just look at the figures here in Barbados in the bubble, right? We needed some kind of context in terms of what is going on around us in our region. In Dominica, a recent surge with some days reporting more than 100 cases have led to lockdowns again. Rises in cases in St. Lucia and Jamaica have also led to new restrictions. What we in the fraternity have noticed that over the past year and a half is that in the region, there have been similar responses to COVID-19 spikes. So if we had another rise in cases here, we could probably expect the implementation of more protocols and more measures. And that is why it is important to know the encouraging effect the vaccine has been having on our figures. And internationally, the stats continue to suggest that the virus will be with us for a very long time. Even with some of the nations that we thought were doing really well. Just today alone in Australia recorded their highest number of cases in a state in one day, with Canberra recording 478 cases today. Then when you look at Iceland, what is happening there backs up the vaccine info. While they're having record numbers of cases, they have not had a single death since May 25th. They're having record numbers of cases in Iceland, the most they've ever had, but they have not had a death since May 25th. What's the difference? They have 70.6% of their population vaccinated, and there's a Delta variant there. So they are recording the most cases they've ever recorded, but have not had a death in months, with a 70.6% population vaccination. So the data has shown that when our vaccination campaign is thriving, both deaths and cases have dropped. I would only imagine that once vaccine uptake is good, we are more likely to keep away from spikes and avoid another lockdown. But I'll leave the health experts to ratify that. What we have learned, though, is that many people struggle with their personal fears versus a type of social responsibility. So we have a choice about if to take the vaccine or not. That is our choice. But then there's a decision on the part of each individual in terms of the role they play in order for us to be partying again, to be not worrying about masks, going to sporting events again. The facts show that the sure way to get to that stage is by taking the vaccine. I believe it's only fair that, but it depends on the individual decision if we get to that stage or not. So while I would never try to bully anyone into taking the vaccine, it is fair that everyone has factual information when making their personal decision, because it's still, at the end of the day, your personal decision. What I want to leave with you is that the same way it is your choice to say no to the vaccine, if after reviewing the facts and the figures you change your mind, that is also your right. Even if you are the biggest person against the vaccine, posting on social media, telling your friends you will never take the vaccine, no one can get upset with you if you have evolved in your position, because that decision as well must also be respected. And I want to thank you for me sharing some of these findings.
Thank you very much, Shane. The final presentation that we are going to have this afternoon before we open the floor to your comments and remarks and suggestions will be by Professor Clive Landis, seeking from the immunological perspective, what are the facts? Professor Landis?
Thank you very much, Chair, and good evening, Prime Minister, and all the dignitaries, especially the public this evening. I enjoyed listening to the analysis by Shane Jones. If you ever wanted to come and do a master's with us, let us know. That was a very good analysis you did. I would add that I called the University Hospital of the West Indies, the medical director, this morning in Kingston in Jamaica. They have 44 ICU beds. They're all full. And 42 out of the 44 persons who are struggling for their life are unvaccinated. What I want to speak to you about this evening is to try to explain two questions which I hear a lot of from persons who I think have legitimate concerns, and I agree that we must not paint everyone who has concerns as a conspiracy theorist or an anti-vaxxer. The two questions I often hear are, how do these new vaccines work? They're very new. And secondly, how were they developed so quickly? So, well, vaccines have been around for a long time. By pure coincidence, the outbreak in 2020 was the 1,000th year anniversary of vaccination. It was first developed and described by a Buddhist nun in China. And the theory behind vaccination has always been the same. You take a harmless agent that mimics the harmful disease agent, and it stimulates your immune response and protects you against the real thing. In the case of the nun 1,000 years ago, they would take an old smallpox, one that has kind of dried out and the particles are no longer infectious, and they blew them into the nostril of a healthy person, and those persons would be protected. Now, it wasn't without risk 1,000 years ago. 1% of persons thus treated actually died, but that was considered to be a good deal because the risk of actually dying from smallpox is 33%, and 100% of people would be completely disfigured. So it's always been about this risk and benefit. And you have heard, how tremendously slanted in favor of benefit it is. And we're all used to vaccinations because we've all had them as children. But it's different when we're adults and we're making a conscious choice. So let me address those two questions. What are these new vaccines and how were they developed so quickly? So all the first vaccines that came through the door, Pfizer, AstraZeneca, and Moderna, are so-called new vaccines. AstraZeneca, it wasn't actually quite as new as you might think. The coronavirus, in recent memory, has jumped 3 times from animals into humans. Once was SARS, 2003 in China. The second was in 2012, called MERS, Middle East Respiratory Syndrome. Now that came from camels into humans. And the team in Oxford, they developed a vaccine against MERS. And they actually published that a few months before this new coronavirus jumped from, we think, bats into humans. So they already had a full vaccine developed against MERS, which is a relative of this new coronavirus. And so all they had to do was slot out and replace the spike glycoprotein from MERS with the spike glycoprotein from SARS-CoV-2. Within 2 weeks, they had put their candidate vaccine into animals and begun the whole process of trials. And if anything, the mRNA vaccines are even simpler. They simply encode the protein, which encodes the spike glycoprotein. That company, BioNTech, in Germany, they had their candidate vaccine in animals in 2 days. It's just so much easier to make a vaccine using these modern techniques. And I would say and remind you, inherently they're safer because there is no replicating virus. There is no virus, dead or alive. There's only a little part, a protein, and so inherently they're very safe. So how were they then developed so quickly in terms of the safety trials? We often hear vaccines, they take 3 years, 5 years, 10 years, whatever. Well, first of all, you have to consider that the regulators, when they're regulating medicines, and vaccines fall under the medicine regulatory agencies, there's a long line of medicines waiting to be approved. There's heart medications, there's liver medications, there might be hair regrowth medications. Who knows? There could be 50 medications waiting ahead of you. And if you have a new vaccine, you just get in line. But not this time. When the pandemic was declared by the World Health Organization, every regulatory agency said, we're going to give this one priority. As soon as the clinical trials are finished, we will then evaluate whether they can be approved. And then, of course, it's just the money. When you make a vaccine, you have to really have a market. So if you look at Ebola, Ebola hit Central Africa in 2014. This was the worst Ebola outbreak ever. It infected 400,000 people. For a pharmaceutical company that has to spend about $1 billion to go through the safety trials, they're like, well, it's not worth it. These outbreaks of Ebola are typically 1,000 people, maybe several hundred people. There's nothing in it for us, they said. And universities had already made a full Ebola vaccine. It was just sitting there on a shelf. And then the Vaccine Alliance, the Global Vaccine Alliance, came in and said, fine, we will pay for it to go through the clinical trials. And so the Global Vaccine Alliance paid for it. And within a year, you had a fully effective Ebola vaccine. And last year, probably no one even noticed that Congo had another outbreak of Ebola. They just ring-fenced the whole area with vaccinations, and it got snuffed out. And so when you have that kind of resources that were poured in, that is how you can accelerate vaccine development very quickly. But it's very important to stress that all the phases of the safety trials were all gone through by all the vaccines that Dale Babb spoke about, which have been approved by the World Health Organization. So the animal studies first to show that there's any kind of efficacy. Phase 1 is usually just in a handful of people to look for very, very severe adverse reactions. Phase 2, maybe a few dozen people. You might be looking at some dose regimes. Again, you're looking at safety. And then phase 3, tens of thousands of people, typically spread over many countries, different places and races, so that you can be sure that it works in everyone. All of those vaccines that have been approved went through all of the normal trials, so there are no corners cut. And the Pfizer vaccine, which we now have, and I'm very pleased we have it, in the country, you remember, that was the first one to be approved. It was approved first in the UK, but I liked what they did in the US. The FDA's hearings on the Pfizer vaccine were public, so the public could see every piece of data from the phase 3 clinical trials. And that kind of transparency, I think, has helped imbue these vaccines, with general acceptability. And I'm hoping that I would have addressed maybe some legitimate concerns about the type of vaccines that we have, these new ones, and how quickly they were developed in the minds of people listening today. Thank you.
Thank you very much, Professor Landis. Ladies and gentlemen, we've now come to the point where we ask you for your contributions. The government of Barbados continues to seek the most appropriate way forward to balance the overall health of the nation, the individual rights of its citizens, and ensuring that the country remains economically viable. No assumptions are being made about the level of interest or disinterest the general public has towards the vaccination, and by extension, no decisions will be made until we hear from you. In the previous sessions, I must say to you, due to time constraints, we have been unable to accommodate as many of our online viewers and questions as we would have wished. To be considerate to all participants in all the fora, this evening, the format by which we will be taking your statements or questions will be a series of questions from our online audience, followed by remarks from the face-to-face audience, and continuing in that manner. Again, to be considerate to as many people as possible, we must ask that you limit your questions or remarks to one point this evening. For the protection and safety of all persons within the auditorium, we ask that only 2 persons stand to make their contributions at any time, and after those contributions are made, the microphones will be sanitized. It is only at the point when you're at the microphone that we would allow you or ask you to remove your mask. Other than that, we ask, as you have done to this point, that you remain masked. Kindly accommodate us as well by stating your full name before you commence your questions so that we can, of course, make contact with you if there is any further information that we need to give you following out the presentations this afternoon. Therefore, ladies and gentlemen, both here in the audience and online, the question being posed tonight again this evening is, to all persons here, what are your thoughts on getting the COVID-19 vaccination today and the approach to testing for the COVID-19 virus? The floor is open, and we'll begin with our online audience. I would ask Ms. Suzanne Bell, who is in the Zoom at this point in time. Suzanne Bell, if she would join with us. What are your
Hello, this is Suzanne Bell, yes. I have a question concerning the number of persons who are vaccinated. Up until this morning, I noticed that there were 101,000 people who were vaccinated. And I have also been vaccinated. I would say that speaks volumes. And I think that can be something that can be used to highlight the safety of the vaccine. My question is, why are we comparing the vaccinated persons to the entire population of Barbados as a percentage when persons under 18 cannot yet receive the jab? We have, up to this morning, again, I saw that they said 29.6% of Barbadians were vaccinated. But there must be, I don't know the percentage of under 18s, but should we not state it as a percentage of the population who can actually be vaccinated?
Dr. George, are you able to take this question?
Good afternoon, everyone. Because everyone in your population is vulnerable, the denominator is the entire population. So every person, both persons below the age of 18 and above the age of 18, are vulnerable to COVID. And therefore, when we speak of the number of persons vaccinated as 29%, that is for the entire population of Barbados. And that is why we are so happy that with Pfizer, it offers us a new avenue for vaccinating children, because we know that children can get COVID and children can sometimes have poor outcomes. So that's the way how we do the calculation based on the entire population. And you must have heard of the term herd immunity. And the whole issue of herd immunity speaks to your entire population. So we don't leave out persons within the population. We look forward to the day when vaccines will be available to all segments of the population. My understanding is that there are currently phase 1 and phase 2 trials involving younger persons using much smaller doses. So this gives, again, us the opportunity to make sure that every individual has the possibility of having a vaccine in Barbados. Thank you.
Thank you, Dr. George. I would now ask Merlene Nurse, again from the Zoom platform. Merlene Nurse, would you join us, please?
Hello, can you hear me?
We can hear you, Ms. Nurse.
Oh, hi, I'm Marlene Nurse. I'm actually a Barbadian living in California. I'm also the Nurse of the Year over here. And it would be great if Barbadians would get vaccinated. It's very important. I work on a COVID unit. I'm in charge of the COVID unit in Washington Hospital. And I've seen a lot of death and despair. So it would be great if they would get vaccinated. It's very important.
Thank you for your contribution as well, Ms. Nurse, and it's good to hear from the Barbadian diaspora. Before I continue, I just also want to mention we'd previously introduced her in her absence, but Dr. Linda Williams has joined us at the table, the head table, and also Dr. Corey Ford is online, willing to take your questions or comments as well. We're going to continue now with a comment or remark from Lisa Joseph, also within the Zoom platform. Lisa Joseph, are you there? I believe if Ms. Joseph is not there, then I'm going to go ahead and ask a question that has been posed to us on the Barbados Government Information Services Facebook page. In light of the donations of vaccines, how much was spent from the vaccine funds to make the purchases? I'll just repeat the question once again. In light of the donations of vaccines, how much was spent from the vaccine funds to make the purchases?
You're gonna speak.
Is that about 2 weeks ago, the figure was about $10 million that have been spent on vaccines up to 2 weeks ago.
Thank you very much, Minister Bostic. A further question from the Government Information Services Facebook page. How many cycle thresholds are the PCR tests conducted at? Are the cycle thresholds ever changed from person to person testing? And if yes, why?
So I would ask Dr. Beckles. That seems to be a laboratory question. I don't know if you can help.
Good evening, everyone. In terms of the PCR testing process, the actual test cycle threshold in terms of the amount of cycles that are done per test is 40. So that happens on every single time we run a test, we go up to 40. However, in terms of a positive test, anything above 36 is considered negative. So our cutoff mark in terms of determining someone to be positive means that they must have come up at the threshold of 36 or less, but the actual cycles of the machine go all the way up to 40 cycles.
Thank you very much, Mrs. Beckles. I have a question here to Dr. Williams. Dr. Williams, a question from Brandon on the Prime Minister's YouTube. Dr. Williams, there has been a lot of focus on the internet about the numbers of persons who catch COVID, are either asymptomatic or have a mild disease. Can you weigh in on this?
Certainly, and thank you for your question, Brendan. One of the things that I've been noticing recently is the amount of people who are saying that COVID is very similar to the flu or that it's a very mild illness. And what I want to point out is why COVID is very different. One of the things about COVID is that although there can be people who are asymptomatic, and at first we did not know how much role the asymptomatic person played in the spread of the disease, there are quite a number of people who become hospitalized or who can become very sick. So for example, with COVID, it's around 5 to 7% of people who will become very ill. With the common flu, that would be like around 1 to 2 or 1 to 3%, or just around 1% in a normal flu cycle year. Now, if you look at Barbados population, just for example, we say Barbados population is 300,000 people, okay? If we had around 5 to 7% of people who were very ill from an illness, that is 5% would be 1,500, 7% would be 2,100. People who need hospitalization, critical care, who are putting the additional burden into our health system, which is already burdened with the non-communicable diseases, the heart attacks, the strokes, and so on that we have every day. If we put that many people in at any one given time, what you have is an overwhelming of the health system to take care of these people. So although people can be asymptomatic and people can get over COVID, there are lots of people who can become very ill from COVID and who also can die as a result. And that is a greater percentage than we would normally see in a respiratory illness. The other thing is that people also get long COVID, so there's also morbidity from COVID. So what they found very early is that asymptomatic people can then go on to develop what we call these long COVID symptoms, where they are chronically fatigued, not able to work. They may experience palpitations, shortness of breath for considerable periods of time after the initial infection. And even people who were mild and who were asymptomatic could go on to develop these long COVID symptoms. What we know now with the Delta variant is that you do not have to have a comorbidity to be one of those people who are in the 5 to 7%. Why it should choose John and not Mary? Sometimes it may be that they may have different makeups, come from different backgrounds, different exposures and so on and so forth. But we don't know all the reasons why one person can become extremely ill and not another. So given that this is not like other respiratory viruses, that the number of people who can become very sick and require critical care is much higher, why should we then take a chance and say, well, I know that I'm going to end up among the asymptomatic. I know that I'm going to end up with a mild disease. You don't know that because none of us have encountered this before in our immune systems, and none of us know whether we're going to go on to be one of the people with long COVID symptoms.
Thanks as well, Dr. Williams. We have two questions here that I believe are very similar, and I'm going to pose them to the panel together. The first is from Joshua on the PMO YouTube channel, and that is there a new priority list for persons to receive vaccines? Earlier, we were told about the senior citizens being given priority. And the second question, which comes from Kay Blades, asks, I hope the Pfizer will be prioritized for those too young for the other vaccinations. Will teenagers be able to get the Pfizer vaccines that have come in?
Can you hear me? Yes. So we took a decision earlier on in when we just received vaccines to make sure that the most vulnerable persons in our population were given to the front of the line. Those persons were identified as persons over the age of 65. Then we had another vulnerable group because we learned more information that persons with non-communicable disease were at high risk for poor outcomes. So we added that group. And then we offered it to the wider population. That is how we proceeded with the Pfizer vaccine. Fortunately, these vaccines have been used widely in the United States and in Canada in populations between 12 and 18 years old. And in that group, we realized that there are some members of that group who may be indeed more vulnerable. For example, children who have cancers, persons with hematological problems, persons with asthma. So that is a subset within the group of 12 to 18, which should be given special consideration. So those are the issues on the table, and we will continue to work with the science that is available to identify those individuals. Before I close off, we had also identified high-risk groups, and the high-risk groups were persons who take care of other persons. So for example, persons in nursing homes, the Queen Elizabeth Hospital, the psychiatric hospital, and those persons we indicated that those individuals, because of their job description and what they do, that they are likely to transmit or likely to be infected with COVID. And what we did was we offered early o'clock. We indicated to the public that we were encouraging healthcare professionals. And up to this time, as I speak, we still encourage healthcare professionals to have the vaccine because you're in a vulnerable position and many of you are taking care of elderly persons and persons with non-communicable diseases. Thank you.
Dr. George, before we transition to the face-to-face audience, just as a follow-up, could you share with us what are some of the complications, the long-term effects of the COVID-19 virus on young people specifically?
So I don't know if Corey is on the call. I think he is on the call, and I would ask Corey to speak because he's
Dr.
the
Ford?
clinical expert.
Good evening, Barbadians. Thanks for that question. So long COVID is something that has been defined, and some of the what's probably the most common are actually neurological features. So for those who made that very simple, sometimes it can be fogginess. What that means, sometimes you're not able to do a simple calculation that may be quite difficult in doing that, or reading or staying focused. This seems very simple. And it ranges all the way to almost every system in the body. So when we talk about the endocrine system, for example, I've had a few kids actually up to recently. One nurse actually who had COVID, and she had persistent issues. In fact, she developed diabetes, and then she also developed thyroid disease as well. And those are now controlled. But those are some of the key things that can happen in individuals. It can also be cardiac manifestations, for those who understand it, really simple. So issues involving the heart, that can occur as well, and also irregular heartbeats. So these are things that can persist in people for long periods of time. But I think one of the other things that people don't often think about is the mental components as well. So there are some mental components that can occur over time, and those are things that have been commonly seen. So long COVID is thought to be really now a real phenomenon. I think the challenge is for all those who are listening, who even want to challenge that, is we have not had a significant, long time to say the word long COVID in terms of COVID, a year and 6 months plus into the disease, and these are things that people are still experiencing. There are some people who also experienced some respiratory symptoms over long periods of time as well. So these are all things that are quite commonly seen now globally. Thank you.
Thanks very much, Dr. Ford. We're now going to transition to the face-to-face audience, and we would ask for the first presenter, if you would wish to join us, sir. Oh, I'm sorry. Mr. O'Neill, you were standing to make a presentation. I'm sorry, Mr. O'Neill stood first.
Madam Prime Minister and members of the head table, fellow Barbadians, good evening. I am Edwin O'Neill, the president of the Congress of Trade Unions and Staff Associations. Mr. Chairman, I thank you for the opportunity to make a few remarks. Somewhere along the line, there seems to have been a thought that CITUSAB is against vaccinations. Nothing could be further from the truth. CITUSAB was, in fact, of all the entities in Barbados, the first out of the gates in support of whatever measures are necessary to keep the economy going. And Madam Acting Prime Minister, you will recall that when the voices were loud at Sherburne to close, CITUSAB, like the boy on the burning deck, stood resolutely against closing of the economy. So it would be somewhat churlish if vaccines are seen as a way of equipping workers to be part of the reopening of the economy for C2SAB to be against it. In fact, C2SAB's pro-vaccine support was shaped with BAMP making a major input at the time when their voices or their voice was accommodated within C2SAB as opposed to a more independent speaking that they are now doing, which is not an issue. I'd like to say that my generation was perhaps the first of modern Barbados to benefit from a vaccine regime. The wheel has now come full circle, as it were, that the children and grandchildren of my generation have reached a point where you don't get into school unless you have evidence of vaccinations in the wider sense. So I say that again to underline that C2SAB and our members understand the science of vaccines. I think it was a major misstep when entering into the dialogue, the national dialogue, was about force or coercion to get vaccines. Barbados is very fortunate that an entity has emerged known as the social partnership, where in the tripartite arrangement, dialogue, negotiations are encouraged. But when a member throws down the gauntlet that they are going to do what they feel should be done, and it can be tested in the court, any self-respecting trade union, as the workers' representative, has got to take a stand. We are all for encouragement. We are all for education. We are all for moral suasion. We are against a dictatorial diktat coming as though it is a papal bull issued from on high. I was fortunate to attend the school. The motto was, and still is, Possunt quia, posse videnta. The literal translation is, we can because we think we can. It is that ethos that produced Barbados' first Olympic medalist. It is that ethos that produced the first schoolboy team to win the BFA Cup. It is that ethos that produced a schoolboy that took on the might of the Barbados attack and up until a few years ago would have been the highest single scorer in the BCA cricket. Why do I make mention of that? It is an ethos which I am sure the Lord School would want to share with the wider Barbadian population, that we can beat this thing because we think we can. We will not beat it if there is a them and us. We will not beat it if there is a dictatorial attitude. The Prime Minister is fond of saying we are all in this together. And C2SAB does not see itself as being excluded from the fight to beat COVID and to put Barbados back on a path to prosperity. So just in case there is any misapprehension or mistake about our message, the labor movement is in support of the science and what the science of vaccines say and portend for the future. The labor movement is against bullyism. And thankfully, common sense seems to have prevailed. And this and other for now allow us an opportunity to have the kind of engagement that should have come from the start. Accordingly, Madam Prime Minister, Mr. Chairman, I am speaking as the President of CITUSAP and commend and recommend the voluntaristic approach. Yes, there are some that are going to be hesitant, but those that are hesitant need an arm of encouragement. Those that are hesitant need an opportunity to see the benefits to those who have been bold enough to be upfront and to take the vaccine. We cannot and will not ever give in as long as there is a modern Barbados to a massacre and a whipping and to get grown, proud Barbadians to capitulate, to give in to what the bullyism thing is all about. I'm much obliged and I thank you.
Thank you, Mr. O'Neill, as usual, for your erudite remarks. We know we can, and we think we can, and we will surpass this issue. I don't know if there are any remarks to be made from the platform. Otherwise, we will move on to our next presenter this afternoon, the gentleman in the blue and gray shirt, striped shirt.
Yes, good evening. My name is Emil Trotman. I won't take as long as he did. I hope I could have.
Could you come a little closer to the microphone? We're not hearing you very clearly.
Yes, good evening. My name is Emil Trotman.
Thank you.
I won't take as long as he did. I just have a few concerns.
Remember, we have to limit you to only 1 point this afternoon as we're trying to get as many people to participate.
He had a long time, you know that. Good. Since the long-term side effects of the vaccine are known, I heard Dr. George say that last week. I also heard Dr. Williams say it last week. If these long-term side effects of the vaccine are known, is it wise to give it to people, say, under the age of 50? Or even the age of 35, given the fact that in 10 years' time, if persons develop adverse side effects from the vaccine, we would then be in a crisis where we might have short-term gain and long-term pain. I just also wish to say that from my understanding of it, for what I see is happening in Israel and so on, persons are getting boosters after being fully vaccinated. And my concern for the medical panel is that if persons have boosters, then the boosters can lead to overdoses in some people. And I'm just wondering if that has been considered, because from full vaccination, you go to boosters.
Sir, why don't we have the CMO or another one of the medical panel respond to that question first?
I remember Dr. Clive Landis said he said it on a call-in program with David Ellis on Sunday. I remember you saying, sir, that immunity is kind of elusive because of the variants. I think I heard you say that at the time. So I'm not sure why we are striving for immunity in a situation where the variants keep coming. You speak of Delta, but I think the last thing I heard is Epsilon, and then there's Lambda. And I'm sure by Christmas we're going to exhaust the Greek alphabet. So I'm not sure why we are insisting on herd immunity when it is basically unattainable. And just quickly, but he spoke a long time, didn't he?
I know, but sir, we must allow the panel to respond to your questions as well. So let us allow the panel to at least respond to your first two questions.
So I can stay here while they respond then?
Let us allow the panel to respond to your questions so that they can give you guidance on it. It may even answer your third before you ask it. Let's open to the panel.
So I will ask Professor Landis to start with your last question, which was on immunity.
Yes, thank you for that question. So herd immunity is viewed by many people as a sort of binary thing. You achieve it or you don't achieve it. That's not the right way to look at it. It's a linear gradient effect. The closer you get to it, the more effective your vaccine response will be. If you happen to hit herd immunity completely, the entire virus will be eliminated from the population. If you get close to it, like you have done in the UK, with the latest variant as well, right in the midst of the biggest outbreak, all the restrictions have been removed. Anyone, I bet you many people here were watching those Premier League matches, all restrictions removed. And the fact is, because they got close to the herd immunity threshold, that link between cases and deaths has been comprehensively broken. We were expecting in the UK, based on the usual link between deaths and cases, over 1,000 cases a day. It barely got over a few dozen. And so just getting close to herd immunity is absolutely effective. It's a gradient, so don't think of it as an all or nothing.
As you said, when you be a situation where you're shooting at a moving target, where it keeps changing all the time, so you prepare to fight a cat, and then the variants become a tiger. So what you came to fight with is no longer valid.
Okay, well, I'm happy to answer that. So currently we've had 4 variants of concern, and the only variant that showed any kind of ability to evade the vaccines was the beta variant from South Africa.
What about Delta?
No, the beta variant from South Africa. And as a matter of fact, in South Africa, the beta variant has been completely outcompeted by the Delta variant. So it's very normal for these new variants to come and replace the previous ones. So the Delta is actually the 5th replacement. We started off with the G418, then we had the A1 from Europe, which came from Valencia, then we had the one from Kent, then we had the one from South Africa, and now the dominant one worldwide is the Delta. And I have no doubt it will be replaced by another one. But the key point is, Mr. Trotman, that thus far, the vaccines are working against the main variants. As I said, the only one where there was a little bit of a wobble was the South African one, but that one has now been outcompeted and is no longer with us.
But exactly, you said thus far. But by Christmas,
well,
we can reach.
This is the sort of thing that has to be monitored. So, for example, sometimes I like to go straight for the worst case scenario. Let's go for the worst case scenario. The worst case scenario is that the vaccine will no longer be effective against the new variant. So where does that put us? That puts us exactly in the situation where influenza is. Influenza mutates far faster than the coronavirus, and we have to have a new vaccine shot every year. So that's the worst case that could possibly happen. And currently, the influenza vaccines, the regular ones that people who are vulnerable are receiving every year, is being bundled up with the COVID. That's the worst case scenario.
But that's why I talk about the boosters might cause overdoses in some people. That's my concern.
Boosters do not function in that way. So when you have an immune response, as a matter of fact, sometimes you require a booster to get an adequate immune response. And so the immune responses tend to wane, and then you have to, that's the word, boost them. So it doesn't function like that. It's not like you have a certain level and you're keeping adding to it. The immunity wanes and you have to boost it.
Mr. Trotman, I think we're going to have to give an opportunity to some others in the audience.
But the gentleman answered the part about for younger people, the fact that if you don't know the side effects, what would happen to persons?
I just want to remind us all that we've taken 6 questions from those persons online. And we would therefore like to make it as fair as possible, as equitable as possible, and provide an opportunity for more persons here, as well as those persons online. So as much as we do want your remarks, we have to manage the flow of questions to provide a fair space for everyone, okay?
Okay, fair enough, but could you answer the question about the side effects?
Sure, go on.
For long-term side effects. Could Dr. George answer that, please?
Good evening, Mr. Trotman. I'm going to answer. You posed a question about long-term effects of the vaccine in terms of what we know, and the way in which you pose the question, you're right. There's a lot that we do not know. do not know what will happen in 2 years, in 3 years, in 4 years, in 5 years. But the vaccines are being monitored now. They're being studied now to see what will happen. I will answer your question, though, on a personal level, Mr. Trotman, so that you can maybe appreciate that as you need to make a choice for yourself with all of the information that you have. So let me answer on a personal level. When the vaccines first became available in Barbados, I had to make a choice for myself. I went running to get the vaccine. On an individual level, I thought of my elderly mother. I thought of my elderly aunt. I thought of all the elderly that I was around. I also thought of myself. We've mentioned the risk factors, and I am one of the persons who is at risk of having a negative outcome from having COVID. So I weighed the benefit versus the risk. There are always going to be unknowns. No one is denying that. But all we are asking is that you think of it on an individual level, what it means for you. Your situation may not be the same as mine. But we're also asking, in terms of the administration and the vaccines, is that you think about the wider community, those around you. I didn't just think of taking the vaccine for myself because I was at risk of having a negative outcome from COVID, but I thought about my mom and my aunt and all of those elderly people and how it might affect them. Yes, long term there may be adverse effects that we do not yet know about, but the data that we do have shows that these vaccines are safe, that they're beneficial, and it shows...
Ladies and gentlemen, please allow Dr. Babb to finish her comments.
And it shows that on an individual and a community level, there is a reason why you can go and take the vaccine and be confident that there's a benefit to you. You have to weigh the benefit versus the risk.
Mr. Trotman, respectfully, I must ask you to please be considerate of the number of persons who want to participate. I believe Dr. Williams may have an intervention here that she wishes to make as well.
Chair, I would like to add to what Dr. Babb said, if I may. So it has been known for other vaccines that you can get long-term side effects. However, they develop quickly, and then they can manifest long-term. By now, we would know if there were side effects. We've already had 1 billion people vaccinated in the world. It's been going for 6 months. When you have a very serious complication, let's say like GBS, that would be known within a few weeks. And so there isn't a known long-term side effect of any vaccine that manifests years afterwards.
Dr. Williams, did you have an intervention? You're okay? Sir, in the back.
Hi, good evening, everyone. Welcome to the panel and all the members in the audience. I could get this raised a little, please.
Just kindly share your name for the record, please.
Sorry, my name is Bakari Bascom, and I'm a resident of Barbados. Concerned citizen, and I'd like to speak today. My brief presentation, less than 12 minutes, is about what this meeting was really about when the Prime Minister actioned it after the meeting with the social partnership. And it was supposed to be a meeting on the view on mandatory vaccines and testing. Not on vaccines and the pros and cons, mandatory vaccines and testing. That's what the Prime Minister said, Mia Motley, and that is where my presentation is on. That's what it's on. So one of the things that Prime Minister Motley stated was that there was going to be an opinion from the Attorney General by the 6th of August on mandatory vaccines and mandatory testing. She also spoke about reckless, I can't remember the term, but she made some points about the legal ramifications of unvaccinated persons in the workplace, et cetera, et cetera, et cetera. I can't quote her directly, but because that would be doing her a disservice, but that is what my presentation is on. Okay? So, in her presentation to the media on that day, she said the private sector wants mandatory vaccines, especially in hotels, and this was also echoed by one of the senators, I think Mr. Grant, subsequently. Especially in the hotels, etc., they wanted mandatory vaccines. So then I asked myself, what is the word mandatory? So I went and I Googled mandatory, and we came up with required by law or rules, compulsory. Wearing helmets was made mandatory for cyclists. That's from the Oxford Dictionary. In reference to law, there's some lawyers up there. Mandatory, the key word is must. In reference to law, mandatory is used to indicate that something is required or obligatory. Mandatory authority describes the source of law that is binding on the court, where persuasive authority is the source of law that carries some authoritative weight, but that the court is not required to follow. That was the definition for mandatory legally. All right? I'm not a lawyer, don't claim to be a lawyer, but like I said, I'm a concerned citizen. And I'm going to get to what I'm going to say, but I also, something happened this evening that I think I need to comment on. In the two presentations, one by, I don't remember her name, the doctor, and then one by Shane. And I have to point out that while given the numbers of unvaccinated, the percentages, unvaccinated, partially vaccinated, and fully vaccinated persons from January to now is a little skewing the numbers a bit because the vaccine was only available mid-February. So if you gave the numbers perhaps from when everyone was fully vaccinated or had the first vaccine, then we may get a better picture of the percentages of vaccinated persons to unvaccinated persons. Because if I give the percentages from last year, it was 100% unvaccinated people that came down with COVID. Correct? Correct. All right. So, and then in Shane's presentation, Shane said that, alluded to the fact that there was a correlation to vaccines and the numbers being lowered. But what I think he omitted for what, when you're looking for something, that's what you're looking at, but you're not looking at the whole picture. What I think he's missing is the fact that there was no lockdown in November and December, and we had a mandatory lockdown on February 3rd. So therefore, that would also skew the numbers with the cases declining significantly after the lockdown. So I just want to add those 2 points on the presentations this evening. They're skewed. That's my opinion of it. All right? So then, let me say that I am not pro-vaccine or anti-vaccine, but I am pro-choice. I am against anything mandatory that goes into your body. And I believe that we need the Attorney General of Barbados, acting or otherwise, to come up with the legal opinion to support the private sector or support those against mandatory vaccines or whatever they want to support, but we need an opinion from the Attorney General.
So, Mr. Bascom, would you wish then for the Attorney General to respond on that specific
He can respond
question?
when I finish, Brian. I can be quick.
Mr. Bascom, I must tell you that we've offered a lot of latitude now for your lead up to the question, and we must ask
I don't have a question, I have a statement, Brian. Right, so...
Mr. Bascom, again, I think that you've posed your question.
No, but I have, Mr. Reese, I have a full statement prepared here. You said we had an extra hour. He spoke for 12 minutes. I'm at 5, and I'm.
Mr.
But
Bascom.
I needed to say those things to get to. Yeah, yes, Mr. Reese.
We're simply asking that everyone.
Okay, I'll try to be as quickly as
everyone else.
I'll try to be as quick as possible, as I was trying to before.
We appreciate it.
Okay.
Thank you.
The correlation of vaccines and lower cases, an education and public information campaign on vaccines and testings was supposed to be rolled out. robust and thorough. We haven't seen it as yet. Where does the employer have the legal grounds to ask the medical status of any of their staff members? Mandatory testing of unvaccinated staff members at their own expense is unconstitutional. It does not follow science, as both vaccinated and unvaccinated persons can contract and transmit COVID-19. This is discriminatory if we're asking unvaccinated people to be tested and not vaccinated people. And again, I say that this is with regard to the initial thing from the Prime Minister, which was mandatory testing and vaccinations. Okay, so there is something called stigmatizing COVID and unvaccinated people, and it's wrong. Protection of personal rights to choose. Discrimination by employers to disadvantage or sever persons for their right to choose ties back to the fact that legally they have no right to even ask you for your vaccination status. And that's what they're alluding to in asking for mandatory vaccines and mandatory testing for the unvaccinated. Persons who should be tested are, this is from what the Ministry of Health would have said months ago, persons who were in primary contact with known COVID-19 cases, persons who are being retested to see if they still have the virus, persons who are arriving into Barbados, persons who are traveling and it is a requirement for them to travel. It is not to be abused by employers or used as a scare tactic to compel people to get a vaccine. The legality of it stands that is illegal right now. The AG has not given his opinion, so what exactly are we discussing? The PM said that the opinion would come on August 6th or before. That was 10 days ago. Today is August 16th. Some members on the panel have continuously acted at the previous meetings as though the town hall meetings were not triggered by this social partnership meeting and a call for mandatory testing and vaccinations by members of the private sector. The fact that someone owns a business does not mean that they can suddenly make medical choices or decisions for their employees. This is 2021, not 1821. There are no slaves on plantations. The workers have rights and choices and should not be disadvantaged because their choices go against what their employers would prefer.
Mr. Bascom, but your basic premise is that this panel is suggesting that mandatory vaccines should be the way that the Barbados government approaches the issue. And the fact is that we have always said that that is not the case. We are here to hear from everyone their views. I don't think it is fair that you should make that premise as the basis of us having these town hall meetings. I would ask you once again and for the third time to be considerate to all of those other persons, both online and here, who wish to participate, and allow the Attorney General to respond with, I am sure, an answer to your question. Would you be so kind, Mr. Bascom?
I'd like to finish my point, Brian.
Mr. Bascom, again, we have to be considerate.
After all the employees nor the government are willing to accept any liability for injuries or death caused by persons being mandated to take the vaccines, and as the acting Attorney General has said, the manufacturers are not liable either. So mandating any such action cannot stand any test of common sense. So let's lend our hearts to common sense. And what should be suggested by any person is proposing such mandates. The PM should also mention the negligence or reckless behavior by persons choosing not to be vaccinated. That's what she did. Again, this was to be examined by the AG's opinion, which today is not forthcoming. And against this backdrop of what those calling for mandatory vaccines and testing is in fact illegal actions, having discussions on how the government is advocating businessmen breaking the law is not how I envision spending my evenings. This is all secondary to the real reason I'm here. The real reason I'm here is because I am seeing the topic of vaccines, vaccinated versus unvaccinated, creating an environment that looks a lot like civil rights movies I've watched. Are we hoping to have a country where the vaccinated and unvaccinated have separate accommodations, where the unvaccinated are scorned and vilified, and Barbadians have to produce their papers to get service or to get employment? Is that the Barbados we want?
Mr. Bascom, again, the effect of your presentation is that fewer people here will have an opportunity to participate.
Okay, in
If you are
closing-
unable to make your point immediately, we will have to take you from the mic. We will have to turn the microphone off.
Okay,
Because you
I'll
are
close then.
taking the opportunity of many.
Okay, so here's what I propose. Instead of law supporting mandatory vaccines, we need a framework for the protection of human rights by the workers. That's what we need. Thank you.
Thank you once again, Mr. Bascom. Attorney General, do you have a response, Mr. Bascom?
To be honest, I don't even know what to answer. I don't know where the question was, because we started from what I would consider to be a flawed premise. The government has no policy in relation to mandatory vaccines, the mandatory COVID vaccine or mandatory testing at this point. We are here to try to hear from as wide a cross-section as possible, not just representing the point of view that you would expose, but the other ones who may have concerns about their children, people who may have other concerns from health. It is only from hearing from as wide a cross-section as possible can a representative government make policies or take steps that embrace the considerations of the populace generally, as opposed to one particular segment or a specified or particularly interested group. So our process as a responsible government, we heard what the private sector said at the beginning. Yes, everybody heard it. Everybody heard it. And the Prime Minister indicated, you know what, let us talk. Let us hear everybody and let us decide the way forward. And that's what we're actually trying to do. So your position is clear. You made your position in the first 30 seconds. At the end of a minute, nobody was in any doubt as to what your position was. So I got you. I got you loud and clear. We've made a note on your position. I got you loud and clear. So I'm now quite willing to actually hear some of the other positions so that when we do formulate a policy, it is representative not just of your opinion, but of the opinion of all contending interests.
Thank you, Attorney General. I believe we have a question here from the gentleman in the green. I believe the gentleman in green is giving away to you.
Thank you kindly.
Please go ahead.
Good evening, esteemed panel, all who are here, and those who are online. My name is Winston Clark. I'm a member of the Barbados Concerned Citizens and the Steering Committee. All right, this town hall meeting was initiated so that we could look at mandatory vaccinations and testing objectively. There is the general opinion, and then this is in no disrespect to the panel, that some of the questions have been orchestrated. You're not stating that, I'm just telling you that that is what has been said on social media, okay? Hang on.
Mr. Clark, no, Mr. Clark.
I'm not going to go there.
Mr. Clark, you went there. That is disrespectful to the panel. That is disrespectful to what we're trying to do. Because, no. Mr. Clark, it is entirely apparent that most of you in here are on the same page. We're not complaining. You can say what you have to say in the same way that Mr. Trotman fully had to say, and whoever else is going to get up and say what they have to say afterwards. You can say what you have to say, Mr. Clark, without going there. So please, I want to hear what you have to say, but please don't cast the proceedings of which you are a part into disrepute.
I'm not doing that. I'm just telling you what was done on social media, okay? Anyway, I am aware that there are different opinions relative to this whole agenda, and that there will be some who will come and they will proselytize about how they found salvation in the vaccinations, etc., and how they should be dispersed to everybody. What I am going to state, however, is that until long-term efficacy has been finalized or conclusive, until these people here who have taken the vaccine or the experts have taken it for more than 18 months, then they can come and speak to me. If after 18 months, I can see that they're ambulatory, there's no dementia, there's no form of effects, then I will then rethink my objectivity. The government has said that they have no direct plans to implement mandatory or intimidative tactics relative to vaccination. However, it would appear to many that they are complicit in allowing the social partners to advance this method. You're not telling them not to do this, makes you an accessory to the fact. Now, Barbadians are primarily a cautious people, and when we go to shop for maybe appliances, like say a fridge or a stove, we try to ensure that if we want it for a long term, a long period, we receive a warranty. How do you expect us not to feel trepidation, apprehension, or be extremely cautious if the manufacturer has said that they cannot be held accountable if you give us this injection? I do not want to stay long. I'm just speaking objectively. I'm hoping that my little added addendum here would give you food for thought. I want some others to come on. Thank you very much.
Thank you very much, Mr. Clark. Now, because of the time that has been taken in the face-to-face interaction, we are going to take one more face-to-face interaction before we go back to the online platform. The gentleman in the green.
Good night. My name is Marlon Brathwaite. I've been a resident for Kingsland for most of my life. Most people know me in the music fraternity as Easy B. I'm a reggae artist. Now, I have trod the Rastafarian faith, but now I have been baptized, so I am of the Christian faith. I come to speak from my heart, because everybody's speaking from a paper, but I'm speaking from here. Long before all of this, long before anything that people created to combat this virus, when I heard the vaccine was coming out, I had this feeling in my stomach. We call it a gut feeling. I'm feeling it right now in this moment I'm speaking to. And it was telling me, don't take it. It was sending a message to my brain saying, don't take it. So how can you all, I'm asking, how can you all convince me to go against my gut feeling and take this vaccine? That's all I have to say.
Dr. Williams, would you like to respond on this?
Certainly, sir. And I understand how gut feeling has a lot of influence on what we do and how we act and our health behaviors. But let me put an analogy to you, sir. If you were presenting to hospital today and you had pain in the lower right part of your abdomen, you go to the doctor and the doctor says to you, sir, I think you have appendicitis. Now, the surgery for appendicitis has the benefit in that we will be able to remove your appendix, clear out any pus, and treat you for appendicitis with antibiotics, and you could get well. But there are risks involved. So if you have this surgery, you have the risk of being put to sleep. You have the risk of having aspiration, which is you swallow your saliva. You have the risk of having infection. You have the risk of bleeding. But if you do not have the surgery for the appendicitis, you have the risk of this appendix rupturing. You have the risk of severe body infection. You have the risk of death. Medicine, the practice of medicine, our job as doctors, is to weigh the risk versus the benefit and to present you, which is the process when you go into hospital and have surgery, we present you with all of the facts. You have appendicitis, sir, our tests show that you have appendicitis. If you do nothing and you decide that you don't want the surgery, here is what is likely to happen. If you do something, the surgery can save your life and can give you antibiotics and bring you back to normal, but there are risks involved. And we present to you the fair choices. Now, you can choose, you can say, my gut feeling is telling me not to take this surgery, right? But there are consequences to that choice. There are consequences to making that choice. What we as doctors do is we give you the facts, we give you the evidence, we show you that people have survived using this before, and that the surgery that we do is safe. But we cannot say that for you, every single risk is removed, because when you present to surgery now, you are different from John Brown and Mary Joseph, etc. But you have to weigh the evidence. You have to look at the practicality of if you do nothing and your appendix ruptures, you have a much greater risk of dying. So let's bring it back to vaccination now and medication, etc. Okay? When you have a vaccine in the market, a vaccine, and this is also to address Mr. Clark, a vaccine is not like a drug that you take every day. If you remember from the last town hall meeting, I said that what a vaccine does is it primes your immune system to fight against the virus. It primes your immune system to recognize when the virus attacks you, that you are ready to have a high immune response by production of something called antibodies, which neutralizes the effect of the virus. That's what a vaccine does. So vaccines are not made to stay in your body and accumulate day after day. And that's why Dr. Landis said that, if there were going to be major side effects of the vaccine, this is 18 months roughly, right? And a little more that we have been giving these vaccines. And we would have seen in the 1 billion people vaccinated already in the world, some of the major side effects. So when we say that vaccines are safe, we are saying that not only based on the evidence of the phase 1, 2, and 3 clinical trials that went before, but we're also saying it based on the evidence that is real-world evidence on a day-to-day basis. So just like the surgery, we give you the facts. You can do nothing. Here is your risk. Or you can do something that mitigates that risk and gives you a better chance of survival. And not only your risk, your individual risk, but also the society as a whole. Because the longer we have a largely unvaccinated population, the more the virus gets to pass between people, and the greater the risk of that virus continuing to mutate even in our population in such a way that it may even develop new or accumulate new mutations within our population. So yes, we have rights. We all have rights. And no one wants to infringe our rights. But rights come with responsibilities. We don't live on an island. We do live on an island, but we don't live all to ourselves. We live in a society. And my responsibility is not only to be vaccinated for myself, but to also to help those who cannot be vaccinated in society, and to help those who are not yet at that stage where they can be vaccinated, like the children, the younger children, etc. So the more people we have that take the vaccine, the less the virus is transmitted within our society, and the less those who cannot take the vaccine will have the risk of getting ill and dying. So risk, benefit, that's what we do. That's what the medical profession is about. And we present the facts to you. What you do with the facts is up to you. And I hope that you will mull over some of the things that you heard today. Thank you.
Thank you, Dr. Williams. I believe Dr. Corey Ford, who is online with us, had a response he wished to make to you, Mr. Bascom, as well.
Yes, thank you. Good evening, everyone, again. I hope my mic is very clear. I'd like to thank Mr. Bascom for his question. I think I just don't want to mull over that and let it go. I think he made some very, very strong comments when he made the comment certainly about the information which was given in terms of persons who are vaccinated and there was a worry about the period for vaccinations. In that short period of time, I was able to get my team to crunch the numbers for me. So here we go. So in the terms of our facilities for persons who are fully vaccinated, there were 115 persons between the time I just started the vaccine. 115 people were presented, and they presented asymptomatically. 58 were presenting symptomatically. So that number obviously is a smaller number. If you check now for those who were partially vaccinated, both between those who were asymptomatic were 40, those who were symptomatic were 55. So that gives, if you look at that particular proportion, for those persons who were fully vaccinated, those who remain asymptomatic were 66%, and those who were symptomatic were 34%. Interestingly enough, it actually follows quite well with international data. For those who were had partial vaccination, they were 42% asymptomatic and 58% symptomatic. I'm going to draw conclusions at the end. And for those who were unvaccinated, there were a total of 440 persons, 484 were symptomatic, and 440 were asymptomatic. If you look at that figure, it actually gives a trend which is quite similar for what has happened throughout the whole year, even leading into last year when this outbreak started, which is quite interesting. There were a total of, that gave a total of asymptomatic persons, 48%, and 52% were symptomatic. So I just wanted to clarify that because I think the point that was made is that the information is skewed, but I think this data is very, 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 very clear in indicating that for those, the majority of persons who are admitted to the facility, certainly between that vaccination period, is consistent with the numbers which were given, even if we subtracted those particular numbers which were mentioned before. And it specifically showed something that was quite interesting, that there was and as I always say, I always give information. I'm not, in a mandatory and stuff. I just want to give the information exactly as it is. So for those who are symptomatic and those who are asymptomatic, it's about almost the same for those who are unvaccinated, but a larger percentage of those are symptomatic, and it's an absolute total reverse for those who have been fully vaccinated. I think this is extremely important and follows quite well with what's going on globally. Thanks.
Thank you very much, Dr. Ford.
Could I possibly respond to, if you would permit me?
Sure. Professor Landis?
Yes, just briefly to 2 points. One that Mr. Winston Clark made. Mr. Clark, you made the very reasonable point that we can't know what we don't yet know. And you said that you would like to come back in 18 months. It's been 6 months since we started vaccinating in Barbados. So if all goes well, we'll see you in 18 months. Now, I did hear Mr. Bascom mention UWI. I wasn't quite sure what it was in relation to. I do want to say that the university is not in favor of mandatory vaccinations. We will not be requiring it. But we're going to make the vaccine available to our students and our staff. And there's going to be a vaccination campaign this Thursday and next Thursday on the campus for all students and all staff. And that will be using the Pfizer vaccine. And I want people to know that the university is making that available. Thank you.
Again, Professor Landis. Now, unfortunately, ladies and gentlemen in the audience, we have to go to the Zoom call. So I'd ask those persons who are standing, if you would just return to your seats. I will make a note of the persons who are standing, and I will come back to you as soon as we've completed taking the calls from Zoom. First of all, I'd like to ask Vonnie Wiggins. Vonnie Wiggins, are you still there?
Good night, I am here.
Yes,
You can
go
hear
on.
me?
We're hearing you loud and clear.
Okay, I've heard a lot for the last 3 meetings, and my thing is, everyone is saying vaccination, immunity, and whatever. So I'm going to break it, vaccination, and all these definitions come from the CDC website. So they say the vaccination, a vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease, protecting the person from that disease. It also says immunity is protection from an infectious disease. If you are immune to disease, you can be exposed to it before becoming infected. Vaccination is the act of introducing a vaccine into the body to produce immunity to a specific disease. Immunization, a process by which a person becomes protected against a disease through vaccination. Antibodies, proteins produced by the body to neutralize or destroy toxins or a disease-carrying organism. And these disease-carrying organisms are specific. And there are 2 types of immunity, active and passive. So they're saying active immunity is long-lasting and sometimes lifelong, and this is when it is naturally occurring. And passive is when a person is given antibodies to a disease instead of them producing it on their own. Passive immunity lasts only for a few weeks or months. Now, these experimental injections that have been authorized for emergency use cannot be mandated. I hear that the acting attorney judge said that they're not mandated. They do not have any, you could say, anything in place. But based on what the Prime Minister of Barbados said, if we cannot come to a consensus, the government will govern. And you can read anything into that. No, my thing is, these are not vaccines because they do not provide immunity. They do not stop you from catching the virus. So as far as I'm concerned, they are not vaccines. They are vaccines, but they were approved as vaccines under the Health Act so that people would not be reluctant to take them. My next thing is PCR. I heard the Dr. Williams said that PCR cycle, the cycle we are using is 40, 35 to 40. And I'm saying, why are you using 35 to 40? Dr. Fauci said, and let me quote you what he said about PCR testing. He said, if you're using a cycle from 35 and up, the chances of it being replication and competent are minuscule. You almost never can culture virus from such a cycle. It is just dead nuclei, period. It is useless and misleading. The PCR test was also approved under emergency use. And they cannot detect virus nor pathogens. It can only count, and I have the article here, warning and precautions. It has only been authorized for nucleic acid. Now, y'all are asking about mandatory PCR. Mandatory PCR testing cannot be legally binding either. Because if you do it mandatory, you got to tell me what you're checking for. You cannot check for the virus, so it can't detect that you have a virus, and it can't detect you have a pathogen. And the maker of this PCR test said that himself. So what are y'all testing for? Tell me, what are y'all finding? Because you can only get minuscule and a lot of pathogens, a lot of different bacteria in your nose. So tell me, do not waste Barbadians' time. trying to get PCR done and trying to get this vaccine in herd immunity, because as we can see, all of the countries who have high vaccinations, they start to spike again with people that are already vaccinated, infecting the vaccinated and the unvaccinated with the virus. Many virologists, many immunologists, many scientists who make many vaccine makers who make vaccines, and the scientists and the doctors who actually go and carry out their own research, saying, bringing the immunizing people in a pandemic, you're making it worse. And natural immunity is better, but they also said vaccinating or injecting children with these injections is not good, because children have natural immunity. They can build their immune system 99.98%. Yes, there will be an odd few that will get sick.
Okay, Ms.
But what you
Wiggins.
can do, instead of giving injection, want to give them an injection, find natural alternatives or find other alternatives. What we are lacking in Barbados is the medical fraternity doing their own research. That is what they need to do. What
So,
research
Ms. Wiggins,
are you guys doing?
Ms. Wiggins, if you would allow me, I would actually like to have Professor Landis, who is one of those eminent scientists that you mentioned, and also Dr. Sanji Beckles, who is also an eminent scientist, to respond to some of the questions you've made on both immunity and also the testing cycles.
Okay, thank you very much, Chair. So I was listening to what you were saying, Vonnie, and I was taking down what you were saying. You started off by quoting the CDC from their website. I'm pretty sure you diverged from the website at some point. So let's just take it to the point where I think you were still quoting from the website. You spoke about the fact that vaccines create specific immunity, and that's different from natural immunity. So if you live a healthy lifestyle, you eat well, you're strengthening your immune response, you have a better natural immunity to any number of diseases. It's not 100%, but you're increasing your chances of doing well against a lot of diseases. When you take a vaccine, you only improve your chance against that particular agent. You only get a benefit to that agent. So if you get immunized against TB, you will do better against TB and nothing else. And so that's the difference between specific immunity, which is what vaccines provide. You say that vaccines, these are not vaccines because they don't provide immunity. I beg to differ. So when you have been vaccinated, you produce a very good antibody response. We've been quite pleased that a lot of the vaccines, particularly the adenoviral vaccines, produce a very good cellular immune response as well. So those are the two arms of the immune response. The antibody response is very quick, gives you kind of immediate protection, and the T-cell response, the cellular immune response, is longer. So the vaccines have been giving very good protection. That's been a very consistent story. I was interested that you spoke about how we could be, and you spoke about many scientists and virologists and eminent scientists saying that we should not be vaccinating across the world, that this could end up in a disaster. I'm sure that you were quoting from Geert Vanden Bossche. So Geert Vanden Bossche, he worked for a vaccine manufacturer, and he passes himself off as a scientist. Well, I have looked up his publications. He has no publications in the peer-reviewed scientific literature. If you want to look up my publications, you will find that in the past few months, I've published on a new variant of Zika, which we discovered in Barbados, and that's published in the Journal of Pathogens. The Pathogens was my second article, which was actually about viruses which are found in mosquitoes. We found 34 viruses in the mosquitoes in Barbados. That was published in Pathogens. The second one on the Zika variant was published in viruses and gosh, I've forgotten the second part of the name, but you can look me up online. So I've also published in the Journal of Virology, and you know, in science, you can't really hide from the scientific literature. The whole idea that Van den Bosch promotes, that this is all going to kill us all, an end of the world scenario, makes absolutely no sense at all, because it's when viruses are replicating that they generate variants. When you suppress them, and you suppress them ever more, the closer you can get to herd immunity, then they're not able to generate so many variants. And it's no coincidence that the Indian variant came out of that huge uncontrolled epidemic which happened in India. Those are the conditions that create the variants. So thank you for the opportunity to answer some of those points.
Thank you, Professor Landis. I believe we'd ask if Dr. Beckles could respond to the second question on testing cycles.
Sure. Good evening again to everyone. So PCR testing is not only for COVID. PCR testing, the technique of PCR testing is used to identify a lot of other conditions, including things that we are very well aware of, such as chikungunya, dengue, HIV, a whole lot of other conditions as well. So it's not specific to say it's only PCR testing for COVID. The advantage, however, of using PCR testing is we speak a lot about the immune response, but the immune response takes time. The advantage of PCR testing is that it picks up things a lot faster, even before sometimes the immune system is able to respond, for you to be able to pick it up in a test. So the advantage of doing PCR testing is that you pick up the virus as soon as it is there and available, and PCR picks up very low quantities of virus, or have the potential to pick up very low quantities of virus, and therefore you can identify quickly and act quickly. In terms of the CT values, yes, we have a cutoff that we determine that after that point of 35, then it's no longer considered positive. And that is because when we think of the PCR testing that we do for COVID, we are looking at fluorescence. So obviously there's going to be some natural fluorescent in the reagents that we are using, and so you have to make compensation or allowances for those. However, the thing about PCR testing with COVID, and if we look at that CT value of greater than 30, yes, sometimes it could be that we have picked up someone who has now recovered and are still shedding and have residual virus that is dead. It may also mean at 35 that you are now becoming ill. And we have seen in several persons who had a first test and came up at 35, when we gave the body more time and we retested them, it came all the way down to 16. And just so you can understand what that scale means, the higher you are, you may be closer to being considered negative. The closer you are to 0, the more infectious, the more virus is circulating in your body. So yes, that is why even in our own setting, if we identify anyone at the lab and it's more than the CT value of 30, Dr. Ford and his team do an assessment. They evaluate what is going on with the person based on symptoms, not only just a test number. They look at what is going on with the person and make a decision on that. Anybody below 30, you can be guaranteed they have active infection and can spread it. But of course, we are very well aware that at 35, it might mean that it's just dead virus in that person, and we have seen in some of our recovered persons having still detecting virus up to 6 and 7 weeks after they've recovered. And that was a learning lesson for us very early in the epidemic last year. So we know when we have high CT values above 30, it may mean that the person has already recovered and just have residual virus. But it may also mean that the person is now actually seroconverting, and that is why it's important to also look at the clinical presentation of the person and not just the lab result at the end. So I hope that clears up a little bit about what PCR testing is about.
Thank you again, Dr. Beckles. I believe Dr. Corey Ford is online and he wishes to make an intervention here.
Yes, I just want to, even again, I just want to lend support to what Dr. Beckles has said. I think she's made a fantastic point. When persons are sent to us at Harson's Point, in terms of that value that we see on the machine, it's not just a matter of they're positive for COVID. What we often do is to try to figure out, is this new disease or old disease? We have seen it too often. If we got to a point, I mean, there's some comments about 35, etc., but I think it needs to be taken into context. There have been some people who have come with values of 35 and then they develop symptoms later. When you repeat as we do the evaluation and repeat their values, they actually fall, meaning they're becoming more positive, which means they have more virus and they're able to spread. Just imagine that we send those persons back into the community, into their households. They can infect their family and their parents, etc. So it's not just, I just want you to just look at numbers. As she said quite correctly, is that those values have to be used in terms of the clinical context. And this is why very early on sometimes you hear us say there were 12 persons, but 3 persons were sent for assessment. And that's exactly what we're trying to do, to figure out if this is old or new disease. And by trending it, what we can do is to figure out, hey, this is a person who's had COVID before, probably never even knew, and then that person obviously is discharged from isolation and is not counted into our numbers. So I think the point here is that because a number is elevated high, it does not mean that you may not be now converted to new disease, and this is very important. Thanks.
Thanks again, Dr. Ford. Another question coming in from the BGIS, the Barbados Government Information Service Facebook page, from Wayne Hoyt is, will the Ministry of Health and Wellness move to have a medical officer explain or break down the daily COVID-19 data, new COVID-19 information and trends, vaccination statistics, and any other medical information to the public on a daily basis or with some regular frequency?
I don't really understand the question because we provide information on a daily basis and share it with the public. Is there something additional that is required?
It sounds to me, Dr. George, from the question, and I'm just interpreting what I'm reading, that the person is asking whether it is possible to have a medical officer actually explain the numbers as they are presented, as opposed to the raw data as it is presently presented.
This is something we are certainly willing to look at. We can have someone communicate to the public in real time with respect to the information released. We have been extremely transparent in this pandemic. I can say that with respect to information shared in the Ministry of Health, we have been upfront, we have been reliable, and we have been truthful in every instance. But if the question is asking for an individual to actually discuss the results with the public, this is something that we can look at. We
Thanks
are
very
going
much,
to
Dr.
be
George.
in this for
Sorry.
the long haul. So COVID is going to be with us every single day. So while you protect yourselves, know that it is part of the routine. And the whole issue of vaccines makes your routine so much more easy. We want to get back to the stage where we can go out and socialize at night. We can do the things that we took for granted a couple months ago. That is the point where we're trying to get. And that is what we are trying to urge the population to get at. Thank you.
Thanks again, Dr. George. Dr. Ford, a question that you may be able to assist us with, and it's coming from one of the participants in the BGIS chat again, and they're asking how many infected persons had to use oxygen to survive until their body was able to fight the virus. That comes from Philip Matthew.
Like I always tell the public, thanks for the question. I'm Philip, I'm Sir Matthews. I don't have that actual information on me, but I can tell you from our data in terms of vaccinated persons and unvaccinated individuals. I gave some data a couple of weeks ago on this, and that has not changed to this point in terms of those who are vaccinated and ended up on having the need for oxygen. So to date, over the last couple of months, we've only seen one individual, as I mentioned before previously, who's actually ended up in our primary isolation area, actually requiring oxygen therapy. And I think this is a very important point. But the issue in that particular individual, as I keep saying all the time, is that individual also has some other underlying conditions. I think we've learned something about the vaccine without disclosing that information of the patient. And that is, yes, it is indeed effective, but in a certain class or type of individuals, people have immune deficiencies, or they may have other conditions which can impair the activity of the vaccine, sometimes there can be a challenge in that area. I think we also need to remember vaccines are not 100% efficient, and I think we need to understand that as well, if we be frankly honest. But they're 97% efficient is more than effective to achieve what we want to achieve in terms of vaccinations.
Thanks again, Dr.
And
Ford.
I must say, if you give me one more chance, I forgot to say, very important, that individual is now at home with their families. That speaks to the efficacy and efficiency of vaccinations. Thanks.
And we're thankful for that, Dr. Ford. Ladies and gentlemen, we're going to transition back to the audience here within the hall. We do have the individuals in order who have presented themselves. We're going to call first on the lady in the striped shirt. Would you kindly state your name again for us? And ladies and gentlemen, I must remind you that because of the practice of social distancing, we're asking those persons who will be coming to the microphone to please remain seated, or if there is an empty chair near the microphone, to approach by being seated in that chair. But we would ask you to please practice good social distancing. Ma'am?
Good evening. I am Judy Ford.
Thank you, ma'am. Go on.
Yeah, good evening to Prime Minister and the panel and the interested Barbadians. Now, I have one very short comment and one very short question. My first comment is that I refuse to get involved in coming to these town hall meetings. And the reason, because the panel is all on the same page. There's no dissenting voices, and that is not, I would not want to sit and listen to that, because everybody is saying the same thing. I'm learning nothing. Anyway, when I was small, we were about 13 or 14 grandchildren, and we would all congregate at my grandmother's house. My maternal grandmother and my paternal grandmother lived close, and there were about 14 of us. And sometimes we would, like children, get into something wicked or not right. And if my grandmother called us and all of us are on the same page, we all got lashes because she said we were lying. Secondly, today I decided to come to this meeting because I read the Nation's editorial this morning. I was very disappointed that I noticed all kinds of agencies, education, whatever, and other agencies being involved in the decision for vaccines for children. No parent, no mother who carried that child to the umbilical cord for 9 months or the father are involved in that decision making. And I'm suggesting that if the parent should be involved because the children cannot give consent. So if the parent maybe they took the vaccine or refusing to take it, they should have a say on whether their children are vaccinated, not agencies. My question, can you speak to the use of ethylene oxide, a medically proven cause of various cancers that is used as a sterilizing agent on these nasal swabs? Dr. Ford.
Dr. Ford, are you in a position to answer that question?
I'm going to pass that question to the lab director. She's the best person to answer that question, and I'll chime in after. Thanks.
Dr. Beckles, I believe he's asked if Dr. Ford has asked whether you would be able to respond to that.
I can, from my knowledge, we do not apply any ethylene oxide to swabs. Apologies. From my knowledge, we do not apply any ethylene oxide to swabs. The swabs are bought, prepackaged, and sterilized. We do not add anything to swabs. We do not use ethylene oxide.
We're not suggesting that that's what you're adding. From my limited knowledge, I'm asking, or you tell me, if it's the ethylene oxide is used on the swabs. I'm not saying you add it. It may come with it. I don't know.
No, ma'am.
From the manufacturers.
No.
You don't know. So who knows? Who can answer?
I believe Dr. Ford wanted to come in now.
Yes, fine. So ethylene oxide as an agent on swabs is not something that is seen. As I was trying to figure out the origin of the question, it's certainly not added as an agent on the swab, and I'm not sure where exactly you're taking the question, but certainly I can say that without any to clarify exactly what you're saying as an agent. Of course, I would say this, and this is why I chose to let the lab director answer, not because I didn't know the answer. I chose to let her answer because there are many different types of swabs from many different types of countries across the globe, and I wanted her to speak specifically because she'll be able to tell you exactly the types of swabs that we use in Barbados and therefore the context of those particular swabs. That's why I diverted to her. Thank you.
So who did you suggest would be able to tell me?
I'm sorry, ma'am, could you repeat that?
No, Dr. Ford said he suggests talking to somebody else would be able to talk about this.
No, I think they both responded to say that it is not used on the swabs in Barbados.
This is the PCR swabs?
Dr. Beckles, can you confirm that this is the PCR swabs according to the question?
I'm speaking about the PCR swabs.
Yeah.
Yeah. Ma'am, I believe we also have a response to your first comment regarding children being vaccinated/tested. Madam Prime Minister.
Thank you, ma'am, for your comment, but I think it is important that I just correct perhaps where you are going. I am not sure what you read in terms of who is being consulted in relation to children and vaccinations, but I was very clear at the receipt of the vaccinations, the Pfizer vaccinations a few days ago, that it was our intention to ensure that all of the agencies, the public health officials, the pediatricians in Barbados could consult certainly with officials overseas. The Pfizer vaccine gives us the opportunity, as you're well aware, to be able to administer to children. And from the time that this virus has overtaken us here in Barbados, we've been monitoring what has been happening in terms of vaccines that could actually be administered to children. We're happy that we have the vaccine here. But I also said that on that occasion that one of the things that we will do is sensitize the public. We've done that on every occasion, whether it was with AstraZeneca, whether it was with Sinopharm. We have always come back to the public and to the people who have to make the decisions and basically provided information on which they can determine whether they want to take it or not. And there is no difference in terms of administering to children in this case as well. So I just want to reiterate, if you were in any doubt, that apart from public health officials consulting with other persons who have walked this road in the health fraternity, the intention is, as soon as we've gotten past that first hurdle, that we intend to obviously consult with parents. As Minister of Education in my other position, there is no way that we would be going to vaccinate children in this country without consultation. As we did with the teachers, we made sure from the outset when there were discussions that we consulted with our teaching fraternity, we involved the unions, we involved everyone to basically alert them as to what the concerns were and to encourage them. And the truth of the matter is, ma'am, that I think that as I listened to all of the comments thus far, there is a lot of misinterpretation of what has been said. I actually had cause, as I was saying to the AG just now, to look back at what the Prime Minister did in fact say, because I was wondering if I was in the same room at the social partnership. The truth of the matter is that on that occasion, and perhaps it's difficult for people to appreciate what really transpires at the social partnership, but it is similar to this setting. A number of views contend, whether it's labor, whether it is the business fraternity, whether it is government, all views come to the table. There were views that were expressed in relation to mandatory vaccination because of genuine concerns in the society that the uptake was not that great. We didn't even have the number of vaccines that we needed to continue ramping up the campaign. What we were agreed on in the social partnership, though, and you can go back to all of the narrative that came out, is that we were agreed that we wanted to encourage people to get vaccinated and also to do testing. That was what was agreed. We may have disagreed in terms of the methodology as to whether it may be mandatory or whether it was voluntary. But the truth of the matter, the Prime Minister did say then that it was important that we consult on the issue of mandatory vaccinations, because that is what had been put on the table. And any good government that has come to office consulting with the people would make sure and come back to the people in order to consult as well. So that's why we keep saying to you, we have never said we are putting a position of mandatory vaccinations, but mandatory vaccinations was put on the table. And it is in our interest as all sectors of this country to come in a peaceable manner, to listen to each other, and to be able to share perspectives and respect each other in this particular forum. So from where I sit, sometimes, oftentimes the narrative is distorted. But I like to go back to the facts, and I can clearly see here that the Prime Minister was crystal clear in what she said. She did say she will govern if she has to. Because at the end of the day, while we listen to everyone, there may be reasons for which a decision has to be made that, having listened to everyone, we have to make a decision one way or the other. And therefore, she reserves that right as the Prime Minister and certainly the government to do what is in the interest of the people. But you would also recall, I said at the outset, that we have heard you. And we've heard Barbadians say they don't want the issue of choice to be taken away from them. We get that. And I think the employees have heard it, the business associations have heard it, and the government has heard it. And we will respect that position of the Barbadian public.
Thank you, Madam Prime Minister. I must say we actually have another intervention by Dr. Corey Ford, who still wants to respond to that previous question about swabs. Let's take Dr. Corey Ford very quickly, because we need to complete the persons who are standing here within the hall as well, and time is getting away. Dr. Ford?
I'll be super quick. I was trying to figure the origin of the question. And ethylene oxide certainly is not an issue. Just as I said before, the answer remains the same. But ethylene oxide is used as a sterilizing agent for the packages, something that's used across many countries globally to sterilize stuff. So you need to sterilize the swab so there's nothing on it, so you know when you use it and do your swab, what you get is exactly what's supposed to be there. So ethylene oxide, yes, is used as a sterilizing machine to try to get any bugs that may be on the swabs. That's normal. That's part of the sterilization process that can be used globally. Yes, and that is used, but it doesn't affect anything related to the swabs. Not something that's on the swabs. But my answer before is maintained as the same. Thanks. I actually figured out where she was going. Thanks.
Once again, Dr. Ford. Now, we do have the gentleman here in the print shirt who is first, but I would ask him whether he would be willing to give way to the lady who has said that she has to leave urgently. It is your call, sir. He's been kind enough to allow you.
Thank you very much. Good evening, panel, Madam Prime Minister, everybody. Well, one question I would really love to ask. Everybody's telling me it's okay to take the vaccine. Can somebody tell me what is in this vaccine? Give me the ingredients, please, so that I will feel maybe, well, I'm lying when I say this, but maybe I'll feel a little safer to take it. And when I go to Harrison Point, if I have COVID, what is the treatment, what I get down there to cure me from COVID? Could somebody tell me? I would like, what's his name, that minister, the health minister? Could he tell me what is in this vaccine that is Mr. Bostic, sir? Could Mr. Bostic tell me the ingredients in this vaccine that will make me better?
Now, I know how heavily involved Mr. Bostic has been, but we must admit that he's not a doctor, and therefore I think it would be...
I'm sorry,
ma'am, I think it would be better if we allow the doctors to speak on behalf of Mr. Bostic.
Whoever wants to answer
and
it,
Lieutenant Colonel Bostic, I apologize.
Know the ingredients, please.
I believe we can definitely get an answer to that from the Ministry of Health, correct?
I would ask Professor Landis to make a comment on the contents of vaccines.
Okay, so we have 3 vaccines on the island. We have Sinopharm. Sinopharm is the actual COVID virus that is heat inactivated, so it's called an inactivated vaccine. So it's kind of like the traditional vaccine.
Ingredients. Tell me, like, you know, you make lemonade with sugar and lime.
But
okay,
ma'am,
so
believe it or not, he is.
I don't want to be rude. I need to know what
Yeah.
the ingredients I'm putting in my body.
Sure, I understand. So, you know, the active ingredient is the piece which is going to stimulate your immune system. There is actually a whole laundry list of inactive ingredients. And those are the ones which, if, for example, you have allergies, you would want to confer with your doctor who can go through the list. And, you know, if you are allergic to EDTA, for example, you know, that is one of the ingredients. A lot of these ingredients would be preservatives and things like that. And so if you're concerned that you might have an allergic response to some of the inactive ingredients, then you would want to go to your physicians and they can go through it. Usually, these inactive ingredients are the same as those you would have had as a child with any of the other vaccines. They're just preservatives. And so if ever you've had a bad allergic response to a vaccine, that's when you need to be concerned about all the list of ingredients. The active ingredient is the vaccine component, which I think is what you were asking about. Okay, so the AstraZeneca vaccine, that has a adenovirus, an inactivated adenovirus, which is actually the common cold virus, but it's a non-replicating, it's like a backbone upon which you put the glycoprotein that reacts and gives you an immune response to the COVID-19. I don't know if that's helped you at all. You did ask. And then the Pfizer vaccine is an mRNA. It's a chain of nucleotides which encodes a protein, which is, again, the spike glycoprotein. I don't know if that's helped you, but you did ask.
Ma'am, I think we may have to move on now to the next question.
So
I hope that has helped you.
Mr. Corey, when I go to Harrison Point...
What would be the treatment?
Yes, please.
Would anyone be able to assist with that question? Dr. Ford?
Yes, the other components of the vaccine, because she asked about lemonade, so I'll help her. So sucrase, some potassium is in there, and a cholesterol molecule which holds and protects the mRNA that was spoken before. When you go to Harson's Point, there are two things that we're concerned about. I'll be quick. One, your ability to infect others. Two, your propensity to get ill. So if you do get ill, we do symptomatic therapy. So the same thing that you might expect if you're at home, but you're infected with a virus, you can infect other people that can hurt them. So remember that component. If you do get ill, some of the management that has been used is based on international standards and include things like steroids therapy. There's enough evidence for that, and some immune modulatory agents, and we've had great success with that. I think in Barbados, we've done well in terms of early identifying people who would have got into trouble. They came and they were well, and then they got extremely ill, and we were able to implement some of those issues to get people better. So I need you to bear that in mind. So it's not only about giving you a drug to get rid of COVID, for example. There's no viral agents that we know will do that at this particular point, to be frankly honest. But what we do is identify you at that point where you might get ill. And this is why many Barbadians have survived passing through Harson's Point. Thank you.
Can you use the microphone, please?
Did I understand that the gentleman over there told me he's putting a virus in me to get rid of the virus? Did I just please?
I think this is a very important point. I think that Professor Landis, I do think that we should ask for clarification so that
yes,
that
certainly.
comment is not the end point.
Sure. Okay, so traditional virus vaccines, which we would have had in childhood, so for example the MMR, those would be actual viruses which are inactivated. They're heat-killed, so they cannot infect you, but the virus is there to train the immune system. And one of the vaccines, the Sinopharm, is one of those. It's kind of what we would call a traditional heat-killed vaccine. The others do not have any virus in them. They simply have the coding ingredient for the spike protein. So they are inherently safe because there is no virus in them at all.
What is spike protein and what is the COVID ingredient?
Sure. If you've seen a picture of this particular coronavirus, it's called corona because it has these coronets, these spikes on it. And one of those coronets is the spike glycoprotein. So it's the bit that the immune system sees.
You put that into me.
Okay, ma'am,
Sorry.
no, we've really allowed you a number of opportunities here, but what I would recommend, if you really do not have to rush off, is that you wait a short while and engage with one of the staff here, one of the panelists here, and allow them to explain it further, because it is a worthwhile
Be
question
happy to
you're
speak
asking.
with you.
May I ask the gentleman in the patterned shirt if he would now make his remarks?
Yes. Thank you, Mr. Chair. My name is Buddy Aaron Laria, and I welcome this opportunity to speak to Barbadians and by extension.
Sorry, Mr. Laria, sorry to cross you, but we would just ask, could you lower the microphone slightly? Because we're not hearing you very clearly. Thank you very much, sir.
Yes. That's better?
Yes, that's much better. Thank you.
Yes, my name is Buddy Aaron Laria, and I welcome this opportunity to speak to Barbadians and by extension, black people generally, on the subject matter of the COVID virus, which became topical last year when it was promoted as a deadly disease that will affect people worldwide, and was declared a pandemic. There are two perspectives to the debate, and we are addressing only one. I would like your permission to put on another side.
Sir, I'm sorry, but at this point in time in the evening,
I understand.
You will have to be
I
very
understand.
succinct. You will have to be
I understand.
harshly succinct.
I came with that understanding.
Thank you.
Yes. But this is who I am. I am a race-first Pan-Africanist and co-founder of the National Non-Governmental Organization. I am a human rights and social rights advocate and have been a student of racism since 1977. My specialized area of research and activism is racism and mental health. Therefore, I have one question to ask the panel, and will also ask your indulgence to present this paper to the head tables.
Sir, if you will present it in its written form, we would gladly take it from you. But if you wish to present it in its oral form, then I unfortunately will not be able to accommodate you this evening.
I said I can't prepare for that. Okay. So I will present it to you.
Thank you, Mr. Larrier. Mr. Larrier, can we move on to another participant in the meantime? Okay, would you leave them with me and I will share them out afterwards, and in the meantime, would you go ahead and make your presentation? And we need you, Mr. Larrier, to be very succinct. We do have time constraints and we have a lot of persons who are interested.
Okay, my question is this. If the head table was presented with irrefutable evidence of a program to depopulate the world, mainly of black people, and COVID is a main instrument of the arsenal of the enemy, would you still be asking us to take the vaccine? Question.
Mr. Larrier, I think that as we have tried to do for the entire session, we wish you, if you have this as evidence, if you have this as a fact that is provable, then we would be welcoming your statement. However, if it is an allegation that is being made without the evidence, then unfortunately at this time of the evening, we cannot entertain the discussion. But if your point is that we should be concerned about this, then we note the concern.
Okay, let me say it right. In 1989, I was part of the discussion of a genocidal plan to kill 2 billion people.
Mr. Larrier, I have to stop you.
I understand.
Mr. Larrier, I have to stop you.
I have put
Mr. Larrier, you're making very wide allegations that have...
That's not an allegation. I'm taking facts. I am stating facts of my life experience.
Mr. Larrier, I'm going to allow the Attorney General to respond to you. He's asked to participate.
Mr. Larrier, I can guarantee you, if you write your contact information on the back of this, I will read what you've put up, and I will respond to you. Just please write your contact information there.
Thank you very much, Mr. Larrier. I appreciate your consideration. Now, we have in the back the gentleman with the cap on, and then also the gentleman in the gray. And I see your hand, ma'am, but unfortunately, we also have a man here in the pink who has been waiting before. So in that order, please.
Testing. Good night. My name is Andre Gill. I'm a concerned citizen. Now, from the beginning of the pandemic, I was observing a lot of things being said on the internet. And I realized that a lot of the people in the press conferences would have belittled a lot of what was said through the social media lines. And I would have heard about them being listed as fake news, conspiracy theories, you know, the whole lot. And I just want to put a point here. For the people who are watching this on Zoom, Facebook, and whatever other social platform, it would be hypocritical to say misinformation is coming through social media, because this is also being broadcast through social media. So I just want to say a lot of credible information has come through the lines of social media from doctors, qualified doctors, Nobel Prize winners, all class of people, and it is up to the individuals to research the qualifications of said persons and take the information however they see fit. So that's just a side point. My main issue is I've been hearing a lot of people push the vaccine, and the main defense against any virus before 1886, when vaccines were formulated and presented to the world. I remember Dr. Clyde was talking about thousands of years, right? So before the monks were observed using this technology, it was only obscured to that population. In 1886, vaccine technology was then presented to the world as a whole. Now, before that time period, we would have relied on what we call natural immunity. Now, over the course of this pandemic, I was reviewing many scientific journals, from the Lancet to Cell to Nature. Now, I got enough education from the Ministry of Education, you know, so eloquently provided me from primary to secondary, but I can read and I can understand. And what I realize is this: when you read the information presented by these experts, and I know the doctors know what the Lancet journal is, there are studies showing that immunity from the virus, original SARS-CoV-1 virus, which the doctor pointed out in 2003, there's cross-immunity to the SARS-CoV-2 virus. This is information that is present for doctors to review. And it is also one of the reasons many other doctors and many other papers are saying for the asymptomatic rate that is present in society. So if we look at the asymptomatic rate since last year, before a vaccine was available, it was above 80% in those who were infected. Now, we got a vaccine here, which is AstraZeneca, which is 62% effective. So why don't we come and say, well, All right, natural immunity is actually giving you asymptomatic, which we will say no disease or no severe disease, no presence of disease, and natural immunity is factoring also in the public quest for population immunity. I don't like the word herd immunity. So listening to the CMO on the press conferences, he said from December last year, we would have had we would have had community spread. Community spread, he said, was the inability to trace where or who has passed the infection. Am I correct? So from in 2020, December, we had community spread of an asymptomatic virus, which means it's going undetected throughout the communities, and we all could be serious. All Bajans are coming to get tested. We know that. So my question to the panel is, what measures are in place for those individuals who would have acquired natural immunity to the virus? Is there any measures in place to track how broad this natural immunity would be and how far spread it would be without first forcing the vaccine as the only alternative? And before anybody come and tell me that the vaccine, because I see it as a person, concerned citizen, I see it as an indirect way to politicize and monopolize immunity, which is an act of nature. You cannot politicize and you cannot patent an act of nature. So if we be honest with ourselves, and I ain't even touching the vaccine, we left that for the next town hall. If we be honest with ourselves, there are many people in our population now who would have had acquired natural immunity, and there's no way or no system provided by the government that people can come and find out if they have the T-cell response or the B-cell antibody response. There's no such system. We just tell people, come and get the vaccine. When you look at the studies that I mentioned, some of these studies actually articulate month by month how long natural immunity lasts. The last time I heard from the panels of professionals that presented to Barbados is 3 months. So why are there journals from Johns Hopkins and Lancet showing that natural immunity stretches far beyond 8 months? None of this information is being presented to the Barbadian public, but it is presented to the wider world. And the fact that it is so effective, the European Union has now identified or acknowledged that natural immunity is indeed a prerequisite to enter their territories. So you can enter the European Union now based off of natural infection. And you can show them you had a previous natural infection, they would allow you as immune to the virus. Why has Barbados not analyzed this parameter as well, natural immunity?
Sir, we have at least another 5 persons we still wish to accommodate.
No problem. I would digress to the next town hall meeting.
Thank you so much.
My questions were already embodied in what I said. I would leave the rest to the next town hall.
Thank you so much for the intervention.
No.
Dr. Williams?
I just want to say quickly to this gentleman, sir, have you ever had the flu? Have you ever had the flu?
Flu, common cold, dengue fever.
Influenza, the flu, common cold.
Yes.
Have you ever had it more than once?
There are different strains of the flu.
Okay.
4 different strains.
Did you become immune once you had the flu once?
If I become
immune once you had the flu once. In other words,
I understand the question.
So hold on, let me finish. In that particular flu season, if you got the flu, you probably would not get it again in that flu season. But by the following year, you might get the flu again, or 6 months later, or later on down the road, you might get the flu again. And the reason is because although your body has experienced the flu before, when you now encounter the influenza again, it is not exactly the same as the one you encountered before. So even though you may have had some immunity, the immunity wanes over time. So your immunity wanes over time. how much time it takes for our immunity to wane against COVID completely, we are still studying that. We're still looking at how long that immunity lasts. Hold on, let me finish. You spoke, I'm speaking. Okay? And the second part of that is that while you are waning from the immunity of the variant that you experience, other variants are coming into the space to which you have not developed immunity. So what we found is that people who were initially infected with the what we call the original strain that came out of China back in early in 2020, they also went on to get COVID sometimes more than one time. So their immunity, which they had to the original variant, waned, and they became susceptible and were infected again. So now we have cases where people have had COVID more than once. Now, if we all decided to let, no vaccine, no protection, no nothing, and we just did what we wanted and let people develop natural immunity, we would have an unacceptable number of deaths. Remember what I talked about? 5 to 7% of the population becoming seriously ill or hospitalized? Well, that would overwhelm our healthcare system. And not only would we get deaths from COVID, but then you would get deaths from all the other things indirectly because we would not have the resources to treat the day-to-day things that normally we should be able to prevent from deaths. And as I told you before, death is not the only endpoint. So if we just let it go to natural immunity and say, well, everyone just develop immunity, we would have an unacceptable number of people who were hospitalized, ill, and die, and also a number of people who die from other causes as well.
Now, you asked me a question. Could I respond? Now, when you look at natural immunity, you are offering a vaccine, right? A vaccine is supposed to simulate. I heard somebody said earlier, it teaches. No, it does not. It simulates an infection, correct? So the vaccine simulates an infection so that the body
No,
can...
sir, sorry, I have to stop you there. Vaccines don't stimulate an infection.
I said simulate.
Oh, simulate an infection.
Forgive my diction.
Right.
Yes, simulate.
But
so...
Hold on. I have to stop you again. What the vaccine is doing is it's priming your immune system to produce what we call an adaptive immune response. So if we put a part of the virus into you, or we put the whole inactivated virus into you, it stimulates your immune system so that when you meet the actual virus, you can then have a strong immune response to it. What we have found is, especially with these mRNA vaccines, we can stimulate an even stronger immune response in your body than when you encounter the virus by itself and have your natural immunity. That is why people who had COVID-19, we recommended that there is a period of time and then they be vaccinated as well. So even people who have had the disease receive the vaccine because the vaccine gives a stronger overall response than having the actual infection itself.
Dr. Williams, hold a second.
Sir, I
didn't get to answer the question.
Sir, we are
she cut me
well
off from
past
answering
closing
her
time, and we now have still 5 other persons who wish to participate.
All right,
I will ask you to, I'm not stopping you yet. I'm asking you to please bring your point to a conclusion so that we can go to the others.
Mr. Moderator, she answered the question, and this is what I'm saying. If you're going to tell me you're going to take 1 point of identification off of a virus, put the mRNA, not the actual protein, the mRNA, this is the genetic material of the virus, for that one spike, which is only one part of the virus that the body will identify, and you can inject that into a person and you can get better immunity than your body identifying all points of identifiable points of contact. That is ludicrous. That is ludicrous. When I have done the research, natural immunity is non-specific. It does not only identify the spike protein of the virus, it identifies the class of virus. And that's why I quoted the Lancet earlier when they said cross immunity. where you have a virus from 2003 that is 20% different. If we talk about variant, 20% different, and the body is still recognizing it from the T cell standpoint. So that is my point. You cannot say natural immunity will wane over time when the body's T cell immunity is still active after 17 years.
Okay, sir. Sir, again, like I mentioned before, I would encourage you to stay behind afterwards and engage Dr. Williams, who I'm sure would be happy, and Professor Landis, to have a discussion with you on the immunological aspects of this virus. I think now we had actually said that the gentleman in pink was next. Sorry, no, the gentleman in gray. I thought you had actually said the other gentleman had asked your question. I apologize.
Yeah, my name is...
And sorry, before you continue, ladies and gentlemen, unfortunately, we're well past the time for closing. So I must share with you now what is the running order, and then we have to bring, unfortunately though, we have to bring the session to an end. We're taking this question from the gentleman in gray, the gentleman standing at the microphone in the beige shirt, the gentleman in the pink shirt seated, the gentleman in the black shirt jack seated, and the lady in the back in the white and pink shirt. Unfortunately, at that point in time, we will have to bring the session to an end. Sir?
Thank you. My name is Michael Lowe. Actually, I thought that the gentleman before me had the same questions I had and same concerns that I have. We are seeking to alienate a group of people who do not want to have the vaccine, but we are not recognizing that there is more ammunition that we can use in this war that we're fighting. Research which he would have been mentioning is saying that before this novel coronavirus came out, there were T cells in human bodies, Germany and France, different places, which had recognized the virus and was able to create an immune response. Therefore, if this is a means of defending the island, then I'm wondering what, as he asks, what provisions are we do we have where we can go about to test persons to see if they already have T cell responses inside of their blood, to be able to see what advantages this may be able to pose for us in terms of being able to combat the virus and being able to target persons who don't need a vaccine because they already have an immune response. Secondly, I agree with him that research is showing that natural immune response is stronger. It may not have the antibody response that the vaccine has. It might not have a stronger response as the antibody response, but it does have T cell, B cell, more other responses that some of the vaccines will not have. And research has also shown that even things like the Spanish flu, persons tested long after the Spanish flu still had T cells recognizing the response. So therefore, I think it's an important question that going forward, if we can consider that perhaps a bigger percentage of our population has already had natural immunity, and therefore we may be able to relax further certain provisions and going forward. Another question I would like to ask.
Sorry, sir. Sir, that was two questions.
No, quickly. It's a different thing. Just quickly,
I
please.
apologize, but unfortunately, no. We can only take those two from you. I'm going to ask Professor Landis or the CMO whether they can respond to your questions.
Yep, okay. So the question is due to, and I think the previous questioner as well, due to the assumption that there's been asymptomatic spread, is there a certain amount of naturally acquired immunity? And in this forum, we've been mixing two terms. Naturally acquired immunity, meaning from an infection, and natural immunity, which comes from living a healthy life, eating pro-immune foods, sleeping well, resting, etc. So we have not measured the antibody level in our population, but we can make some pretty good guesses. One thing I want, if you remember one thing from today's information, please remember this. We've been very lucky in the Caribbean thus far. If you compare the rate of cases and deaths per population, so you're able to compare small countries, large countries, and regions, the Caribbean has done very well. And we have had about 1/10 of the number of deaths per capita compared to the USA and compared to South America. So we have been very lucky. And in the USA, in places where there's been high rates of infection, your naturally acquired immunity would normally be around 15%, 1/5. So here in Barbados, it would be minuscule. There is no way that we can relax by thinking that we're somehow maybe like Manaus in Brazil, where 70% of people have been naturally exposed. Fortunately, we have not been naturally exposed. That's why we haven't seen death on an industrial scale here, and I'm so grateful for it.
Sir, I apologize, but we cannot allow for a follow-on, okay?
Speak
in the beige
afterwards.
shirt, sir?
Speak afterwards.
Good evening. My name is Audie Niles. Good evening to the panel. I can stay here and speak to, I would like to engage the medical personnel who form the panel, but I choose not to. I prefer to speak on a different slant, if you may. There is an issue, we have the worldwide speaking to such things as the efficacy and the safety of the vaccine and so on and so forth by eminent people all over the world. And I am concerned that given such, because we have the pros and we have the cons, but given such that this government elected by the people choose not to err on the side of caution. But that is another matter.
Sir, I'm going to remind you that we're going to need you to bring your contribution to a point urgently. We really are well beyond time, and we still have others who wish to contribute as well.
My stance is mainly on the hint or suggestion of mandatory vaccination. We've been told that it is not on the table anymore. At this time, if I may correct it. However, what I'm wondering or what I'm thinking of is, given the pro-capital nature of the government, what happens with the unvaccinated persons who by choice, who chose to be unvaccinated by choice? What happens to them from an employment perspective, from a consumer perspective? What happens when a government which so strongly supports capital, and capital puts up on the front of their workplaces, no admission unless vaccinated or a PCR test? If we take 20,000 people in this country who are unvaccinated, that's 20,000 consumers. Imagine 20,000 additional people on our national insurance and employment benefit scheme. Imagine 20,000 unvaccinated people unable to shop because capital has their rights. Imagine 20,000 people seeking to exercise their right before the employment tribunal. Imagine 20,000
Sir,
people
what
not
then
able to work.
is your final analysis as far as this is
This
concerned,
is the
or final question?
Excuse me, sir. This is the question that I am posing. Has this whole aspect been carefully thought of? Why are we, as a nation that has elected a government, not seeking through the social partners on matters such as this in going forward. This is what I am finding to be rather disconcerting. We need to address that situation. We need our social partners, C2SAB and so on. We need the government not to seek to abrogate the rights of the unvaccinated through the efforts of capital in this country. This is what the slant that I am coming from. Remember, our Prime Minister has said we have been taught to think for ourselves. And Bajans are thinking. They are thinking, they are watching, and this 166 square miles that I live on and born on, I don't want to see anything come into anarchy because a man can't buy food, can't pay his bills, or such like.
Thank you, sir.
Thank you.
Thank you very much. I believe we're going to take another audience response. I'm sorry. Sir, just hold one moment. I believe
you did ask,
there's a response from the panel.
Sir, you did ask some very valid questions, and I assure you that the government is considering all of that. We are considering the rights of the persons who are unvaccinated. We are considering the rights of the persons who don't want to be vaccinated. We are considering the rights of the persons who want to and have been vaccinated, and their rights vis-a-vis not wanting to work with somebody who is unvaccinated. We are considering the rights of the owners of capital. We are considering the rights of business owners. We are considering the rights of the tested patients who go into the QEH who don't want to be treated by a nurse or a doctor who has not been vaccinated. We are balancing all of these things and listening to all of what you say and the representations from every person and every interest group in the social partnership to come up with as best a solution as we possibly can. It is not going to be easy. Whatever we decide to do at the end of the day as a government is not going to please everybody, but I assure you that we are letting all views contend and we're taking all of it into consideration. So I can assure you that all of the things that you mentioned, we are actually considering.
Sir?
Good evening to one and all. My name is Sean Butcher. I manage a concierge company on the island. Basically, what I'm saying here in this room, in the country, is fear. Everyone has a fear of either living or dying. And for me personally, I took the vaccine because of work purposes, taking people to and from the airport, going to and from for shopping purposes, as well as providing for my family. At the end of the day, everyone has their opinion, everyone has their own rights to choose what they want. But if realistically speaking, from the time we was a little child, we was taking vaccine. We end up getting sick or we may not. When we take the vaccine, it's up to us then to take care of our bodies as well. Whether it's that you do your regular cleanse, you do whatever it is you need to do. The public basically fear is because you're not getting the answers that they're looking for. Right? Everyone is there every single day. Everyone has a choice. Everyone has a right. My choice was to take the vaccine. It's to help with my family, help with my friends, help with my business. I provide protecting myself and I'm protecting others. So at the end of the day, just as I say, everyone has their choice. Everyone has their rights to choose what they want to do. Thank you.
Thanks very much, Mr. Butcher.
Good evening, members of government, members of the panel, the listening audience. My name is Brother Abdul Rahman. I serve as a student minister in the Nation of Islam under the leadership of the Honorable Minister Louis Farrakhan, and I am also representing a group of Barbados concerned citizens. Just to say it's not fear that's in the room, it's intelligence, it's not fear. Now, the following data comes directly from reports submitted to the Vaccine Adverse Events Reporting System, or VAERS, which is the primary government-funded system for reporting adverse vaccine reactions in the US. Data released August 13th by the Center for Disease Control and Prevention, the CDC, showed that between December 14th, 2020 and August 6th, 2021, a total of 571,831 total adverse events were reported to VAERS. This number included 12,791 deaths and 77,490 reports of serious injury. US deaths reported as of August 6, 13% occurred within 24 hours of vaccination. 19% occurred within 48 hours of vaccination, and 33% occurred in people who experienced an onset of symptoms within 48 hours of being vaccinated. Now, in terms of adolescents, this week's US data for 12 to 17-year-olds showed 16,408 total adverse events, including 983 rated as serious and 18 reported deaths. 2,424 reports of anaphylaxis among 12 to 17-year-olds, with 99% of cases attributed to Pfizer vaccine. 419 reports of myocarditis and pericarditis, heart inflammation, with 414 cases attributed to Pfizer vaccine. 81 reports of blood clotting disorders, with all cases attributed to Pfizer vaccine. Assuming that the panel would accept this data coming from VAERS and the CDC as credible, and the fact that these reports are significant in terms of injuries and deaths, I am suggesting to our Prime Minister, our Minister of Health, and our Chief Medical Officer that you are not being completely truthful with the people of Barbados when you declare these experimental vaccines as being safe and effective. How can you declare them as such when you know, and we know also, that they have not endured the proper clinical trials to prove them as such? These vaccines are new, unapproved, and investigational, approved for emergency use only. I also ask our Ministry of Health to stop attempting to suggest to the people that these vaccines, the mRNA in particular, are the same as the traditional vaccines that have been administered to generations of Barbadians. They are not. The messenger RNA is a completely new and experimental protocol. We want the panel to report to our Prime Minister, Mia Mottley, that a large portion of the populace of this island do not desire to take the risk of taking these experimental vaccines. In addition, we urge our government to ensure that the powerful lobby of the social partnership, which we know is just a pretty sounding word for corporate Barbados, does not supersede the wishes of the majority of the Barbadian people. We demand that our government call to heal those members of the Barbados Hotel and Tourism Association, other tourism operators, and local businesses that have been using illegal and unethical coercive tactics to encourage, incentivize, and compel COVID vaccination. We also demand that they cease immediately with the threats of discrimination, unemployment, and destitution. Thank you for listening.
Thank you, Mr. Rahman. I think we have now the final presentation for the afternoon, for the evening, I'm sorry.
Good evening. My name is Mary Clark. Yes, look back. I am peeved this evening at our fellow Barbadians. Very peeved. Because I am looking at a disgruntled and ungrateful section of Barbados. I would first like to commend the government of Barbados, the Minister of Health, and all the medical doctors, whether on this panel or outside of this panel, that have given their lives, sleepless nights, to protect us on the front line. I work on the front line with your children. And it is hard to come here night after night and hear a pack of concerned citizens try to pull down the government and the medical profession. That is why I'm so peeved. Sit down, Winston. That is why I'm so peeved. Walk out, because the truth hurts. Unless you're in the situation, you do not understand. Last year we were doing regathering. The very last regathering in February, when we gave a son of the soil the award, the February he was recalled back to his workplace in Miami. He caught COVID on the plane. By the 5th of April, he was dead. There were no vaccines. There was nothing. Understand the pain that I felt and his family felt because we were unable to fly to see our loved one for the last. We had to view it online. This propelled me to be fully vaccinated to protect myself, the children that I am taking care of, your children, and everybody else around me. It had to propel me because I want to live. I am not a selfish person, and y'all are coming in here selfishly and very irresponsible about this vaccine. I will say to you, we were small too, and we were born in this country. I have children and grandchildren where the vaccines are mandatory. At 6 weeks, our children are vaccinated. Do we know the properties of these vaccinations? No, we don't. We don't even ask the doctors, the nurses, what it contains. But people coming in here tonight to ask learned people what the vaccines contain. And we take MMR, we take mumps, we take rubella, we take influenza, and as you rightly said, Dr. Williams, we still get sick, but we're able to fight it. And I am saying to you, be grateful. Barbados is a very small country, and today we have 48 deaths because of people's hard work. We had people that died on the front line for you and for me. This is like our God. When we crucified him, when Pilate put him out there, and the sick gave him Barabbas and crucified Jesus. I'm saying to you, Barbadians, wake up. Wake up. Yes, your comments are valid. The vaccine is not mandatory, but don't be selfish either. Be responsible citizens. Be responsible. Care for each other. Because I tell them when they're vaccinated, don't come and talk to me. Because obviously, if when I got Delta, I can catch it, I can fight it. But when I can die, that's why God said tonight, stop the ignorance. Stop it. And let us be grateful for what we as a small island has achieved. since we had this shutdown, and let me go even a little further, man, to tell you all, right?
No, ma'am.
This country shut down and run, and the Prime Minister turn around and feed one of mine, and we're not coming in here
Ma'am.
and being ungrateful.
Ma'am.
No, it is not fair to this country, nor the medical team. Sleepless nights when the Caesar tell one master and behave. When they had to do it, we had to put in the master and put one to go to the banks by surname. That is how one like it. When I like the master hand, when I don't like the nice hand that the delving out to tell you all, take the vaccine, protect oneself and everybody else.
Thank you for your contribution, ma'am. And I think all of the medical staff, thank you for the congratulations you've given them, for the hard work that they've put in. This has not been an easy journey for any of us, but more especially for those persons who are on the front line. And I think we need to use that word less euphemistically, because they really are on the front line of what is a war. So I think all of those persons need a round of applause for the hard work that they do in the medical fraternity. Ladies and gentlemen, as we bring this evening, to a close, we have one final aspect that we wish to complete, and that is a vote of thanks, which I will now ask Mr. Wayne Waldron, the Acting General Secretary of the National Union of Public Workers, to provide for us. I hope I don't need to ask you to be brief, Mr. Waldron.
This one is, okay, good to hear it now. All right, gives me pleasure to give the vote of thanks to the Honorable Santia Bradshaw, Minister, Prime Minister Acting, the Honorable Wilfred Abrams, Attorney General Acting, and also Minister of Home Affairs, Information and Public Affairs, Dr. Kenneth George, Chief Medical Officer, Dr. Dale Babb, Minister of Health and Wellness, Dr. Linda Williams, President of BAM, Mr. Brian Rees, who did an excellent job chairing this meeting as moderator. Also Professor Clive Landis, who is Pro Vice Chancellor and also Principal of the University of the West Indies. Mr. Shane Jones, who is a senior journalist, Caribbean Broadcasting Corporation. Mr. Anitin Bowers, representing the tourism sector. We have Minister Colin Jordan, the Honorable Colin Jordan, who's the Minister of Social Partnership and Labor Relations. We had Dr. Corey Ford, who was on our Zoom, representing us well in terms of answering questions. Representing for Labor, Brother DePizzo, who is General Secretary of the C2SAB, Brother O'Neill, who is the President of also C2SAB. I know there are many others, others that were not mentioned, all distinguished persons at the table. Ladies and gentlemen, it gives me great pleasure to bring this vote of thanks to this important town hall meeting, to hear the open views, to open the democratic process. We had some emotional presentations. This is what it's all about. We respect every person's view, but we know that these town hall meetings serve the purpose of getting the views out so that a determination can be made on the way forward for vaccination. We would have fair labor position that we respect the process of freedom of supporting the vaccination, but at the same time, giving the freedom of choice. We have heard the technical side, given the knowledge of the vaccination program and the benefits, and we have fair persons in the audience giving their reservations about the pros and cons about the vaccination. But all were respected, and this is what democracy is about. So again, it's my pleasure. It has been a very candid and very participatory session. I would look forward to the final session. On Sunday is one more session that we would have. And We will continue to be very open in our views and very democratic. And therefore, as I close, I wish everyone travel safely to their journey, and we look forward to further participation in these sessions. Thank you very much.
Thank you very much, Mr. Waldron. Now, though we've come to the end of this evening's proceedings, I wish to share with you that the presentation by the Ministry of Health will be available on the Government Information Services website subsequently to this evening's event, along with as many of the responses to the plethora of online questions and remarks that were posed as well. We weren't able to answer all of those questions nor respond to all of the remarks online, but where possible, we will try to have those on the Government Information Services website. We will continue to engage with you across the island. We do have one more session, which will be held at the Combermere School on the 18th of August, on Wednesday, from 5 p.m. until 8 p.m. And again, that will be accessible online as well. I want to thank you for joining with us in this very important consultation and dialogue this evening. We look forward to hearing more from you. We look forward to the final town hall meeting, and we will ensure that this information is worthwhile and is used to the benefit of all Barbadians as time goes on. Thank you, and have a safe evening.